Okay, YouTube world, we'll get started in just a minute. I'm having a few technical difficulties. I'll be right with you. Good morning. Okay. All right. I think we're ready. All right. Good morning. Happy Monday. Those two words never go together. Never. All right. You guys had 2 chapters of homework over the weekend. You had chapters 8 and 9. 8 was on nutrition, dietary chapter. 9 was on rehabilitation. Does anybody have any questions for me on those 2? Anything you need me to explain to you? No? Okay, let me go ahead and get your scores for chapters 8 and 9. Maria. Thank you. Marva? Thank you. 95? Okay. Got it. Katie?
7 is 100, 8 is -1, and 9 is 100.
Thank you. Jera?
8 is 85 and 9 is 100.
Thank you. Alyssa? Thank you. Jordan? Jessica N?
Chapter 8, 95, and chapter 9, 95.
Thank you. Edward?
95 and 90.
Thank you. Jeanette?
Chapter 8, 95, chapter 9, 100.
Thank you. Sheradine? Emily? Jessica S? Brooklyn? Kevin? Somebody emailed me with their scores. Give me just a second here. Let me pull these off of email. And Emily. Okay. So Emily, I do have your scores here. Thank you very much. 100.
I know Jessica's on her way. She had to drop her kids off at school.
Okay.
She'll be a little late, I think.
No worries. Okay. So Emily, I do have all of your scores. Thank you very much. All right. Oh. So does anybody have any questions before we go on? Anything that we need to discuss? Anything that you aren't comfortable with? Anything? No? All right. One class left, guys. One class after today. You're almost done. Remember on the first day I told you it was going to go really fast? It does. You look back, you're like, we're done already? You've come far. You've learned a lot in a very short period of time. Hopefully you've learned it in a way that it will stick, that it will stay with you. But remember that you have the review sheets. Those review sheets make a fantastic quick review packet before you go test, rather than trying to go back through absolutely everything. If you just look at those review sheets, it will remind you of everything that you've learned so far. I made them very strategically to become a instant review for you right before you test, okay? Remember that you do have this room available on Mondays and Wednesdays until 4. Once you graduate on Wednesday, it'll be 1:30 until 4 on Mondays and Wednesdays that you can come in and practice, okay? If you have not registered for the test yet, you need to do so. Good morning. Don't put it off. Your confidence is not going to grow anymore from this point. You are at your max confidence level, because once you leave this classroom, you're not going to magically come up with the confidence you need. So register. You are way more prepared than you think you are. I went to HOSA State competition on Friday. I'm their celebrity guest. It was a ton of fun. I've been going for like 14 years now. And I connected with literally hundreds of students that came up and told me, I passed the test because of you. I passed the test. I'm now a CNA. Guys, you are way more prepared than you think you are. And the reason for that is because you're comparing yourself to me. You're not at this level. The test isn't testing you at this level. The test is testing you against other yous, not against me. And it's very, very important that you understand that. Okay? You don't have to be perfect at this, but you do have to have enough awareness that you're treating that person like a person, that you're concerned about their well-being, that you don't leave them exposed, that you don't leave them in unsafe situations, and that they have an opportunity or a way to get help when they need it. That's really what the test is about, okay? It's not about how many washcloths do you need for this skill. You guys get all tied up in the minute details, and they do matter a little bit because you got to have the right supplies to do the skill the right way. You know, whatever we wash, we rinse. So if you don't have enough washcloths, how do you make that happen, right? But it's not, there's no checkpoint that says got the right amount of supplies. It's not what it's about. You guys make this test technical. It's not. It's patient-centered, okay? And if you've kind of listened throughout the whole program, I've been weaving that in. Oh.
So we aren't graded if we forget something in our supplies.
You're not graded. Nope. No. What is graded, though,
Is the outcome of the patient.
right, the outcome of the patient. So if we don't take enough washcloths and we don't rinse, what kind of an effect would that have on the patient? Dry skin. And dry skin tends to crack. And what does that make? Yeah, absolutely. So it's not that you didn't get enough washcloths, right? It's that there's a negative effect on the patient. But let's talk about that for a second. So let's say that you're doing partial bed bath and you don't have enough washcloths and you're halfway through the skill, right? You've washed the front, you've rinsed the front, you've dried the front, turn them over, you wash the back, and then you realize you don't have enough washcloths left. What do? So your patient is on their side in the middle of the bed, in the middle of a skill, and you don't have enough supplies. What do?
Can you just make that a correction?
You can, but at the end of the day, we still have soap on the patient. So how could we fix that?
Well, if they're in the center of the bed, they're safe. And if they've got the call light, and I would have to say to them, you know what, I'm sorry, I forgot. I need to go get you another washcloth. I'll be right back. Here's the call light. I'm gonna go get that and wash my hands or whatever. When you come back,
Make
I'm
sure
gonna
they're
get it,
covered.
and then I'm just gonna continue.
Okay, make sure they're covered. Yep.
Oh, good.
So yeah, so we would want them in the center of the bed. Remember, they always have to be in the safe zone, right? But we have patient cootie hands. Can we reach into that clean supply area with patient cootie hands? So we need to wash our hands before we get the washcloth. That is what they're grading you on.
So we can do that as long as we do it in the right way. So wash your hands before you leave the room, and then, well, before you leave the room,
Right,
get the
right.
supplies, wash them when you get back, and just continue.
And continue on. As long as the patient is covered in the middle of the bed and has a way of getting in touch with
I
us.
thought about that question over the weekend, and I was like, is that something that we can even correct?
Yes, you can, but you have to go a step further than just a verbal correction. Yeah.
And sometimes that's the best test for them because then they can really see those, what do you call them? The people that are testing.
Evaluators.
Evaluators. If they say you correct a mistake correctly, that's going to give you more stars for you. Because to me, it's saying, hey, this person, because that's going to happen in real life.
It's absolutely going to happen in real life.
It's going to happen, more than once in real life.
Absolutely.
So that's what, like you're saying, what they're really looking for is how are you going to handle when you make some bloops? How are you going to handle that?
Right. Right.
So you're going to pass with 10 colors because you're going to know what to do.
Yeah. It's like I said, not about being perfect. Do you think life is perfect out there?
No.
It's messy. It's messy. Life in general is messy, right? But life in a clinical setting is really messy because you've got call lights going off and you've got emergencies happening and you've got nurses calling your name from the hallway when you're in the middle of toileting a patient. It is messy, right? The test is actually perfect case scenario that you're never going to see in real life because it's blocked out all of those external factors that you're going to experience in life. It's really kind of condensed it down to just this little bubble that you're living in for test day. So testing really is best case scenario. If you forget something during test, you've got an opportunity to correct it very easily. In a clinical setting, it gets a little bit harder, right? We tend to think of the test as something we have to get through to start our career, not that the test is the easiest part of our career. Do you guys get that? Do you understand that? It's way messier. So instead of dreading the test as, oh my gosh, this is something I have to get through to get to my career, you actually need to start looking at the test as, wow, this is going to be the easiest career day of my future career.
And that's really true.
It is. It is. At least with the test, you know exactly what to do. I've given you all the secrets. In real life, you're going to have a lot of situations you're going to come up against where you're not going to have all the answers. Who do you go to when you don't have the answers? The nurse. That is the one piece of advice that I need you to take out of here. You're not, the test, you're going to have all the answers. I've given them all to you. There is nothing that's going to happen on the test that you are not prepared for. Okay? It's when you get outside of the test, when life gets messy. I need you to know what to do then. And we've been preaching it since day one, hour one. So when you find yourself in those situations where you just don't know what to do or what to say or how to handle this, then who are you going to go to? The nurse. Okay. If you don't take anything else out of here, please take that with you because you don't have enough information to make decisions and you'll put your patient in jeopardy. Okay. Does that make sense? Good. Okay. Any other questions?
Do we wear our scrubs?
That's a great question. What do we wear for the test? So, and we're going to talk about this on Wednesday a little bit more, but for the exam, there is no dress code. The only requirement for testing is closed-toed shoes. That's it. That is the only, Bikinis, you laugh, but I will tell you, when we were a testing center, we actually had a girl, she had no idea what the test was. She thought she could just come in, sit down, take a test, a written test, and then go. She was going to the beach.
Oh, yeah. Poor girl.
She was stopping by to test on her way to the beach. She had no idea that she actually had to perform skills. She was not prepared at all. I'll be right with you, Anna. Not prepared at all for the test. So she comes in and she's wearing flip-flops, a bikini, a t-shirt over her bikini top, and a pair of cutoff shorts. And it was perfectly fine for her to test, but she had flip-flops on. So she actually had to go into my store and buy a pair of shoes in order to test. And unfortunately, she wasn't successful because she didn't know about the clinical part. Somebody somewhere along the line just told her, oh, yeah, you can challenge the test. Just go in, take the test. You'll be fine. She had no idea. This is probably about 15 years ago, before the internet was really, you could get all the information. So she got some bad advice, but, that, yes, people do show up in their bikinis from time to time. I would like you to be a little more professional. So there is something to this, and let me explain my advice to you. If you want to wear jeans and a t-shirt, that's fine. There's no problem with that, but there is such a thing as look the part, act the part. Okay? Does that make sense to you? When you go in scrubs, you will automatically act more professional.
I feel like I will feel more confident because I'll be in what I've been learning. It's familiar to me.
It's familiar. Yep. So that's why I have you wear scrubs to class. That's why, because I want you to get comfortable in them. This is going to be what you're going to wear for the rest of your career forever, right? So you've got to have a way of getting comfortable. The first day you put scrubs on, you probably had a little imposter syndrome. That's normal. It's like you're playing dress up, right? That's normal. But after wearing them for a few weeks, you're now starting to get comfortable in them, and it's kind of part of the whole package. I would prefer that you're in scrubs. I would prefer that. You don't have to, though. If all you have, especially for you guys at home, if all you have is jeans and t-shirts or yoga pants or whatever, you have in your wardrobe, don't not test because you don't have scrubs. Go take the test. Oh, absolutely. Absolutely. I've got some brand new ones by the front window that are athletic. They look just like, and they're actually made out of the same fabric as the big yoga pant designer people. I'm not really into all that, but so yeah, if that's all you have, go test, wear it. Don't not test because you don't have scrubs. But for my guys, I would prefer that you're in scrubs. You don't have to. You don't have to take a watch. You don't have to take a pen. You don't have to take anything but you. 2 forms of ID. No, because you're not testing on blood pressure. Yep, pulse and respirations. So in the testing center, they have clocks above the sink and above the bed. And they will have pens with the documentation form. So everything is covered for you during the test. So Anna says, if the resident is on his side with soap on his back and I forget the washcloth to rinse, do I have to put him back on his back, give him a call light, and lower the bed before I go grab it? So Anna, we actually just covered this. So what you would do is make sure they're in the middle of the bed. It doesn't matter whether on their side or on their back, as long as they're in the middle of the bed. They have to be in the safe zone. So think about you when you're laying in your bed. You're not always on your back. That would be, uncomfortable to have to stay on your back all the time. That's just not natural. So on their side is fine as long as they're where? In the center of the bed. The bed should be in the lowest position. Yes. So if you raise the bed up, we do have to talk about that. If you raise the bed up to a comfortable working level, you do have to lower it, because if they do try to get out of bed, where does that floor have to be? Yeah, right where they left it, right where they expect it to be, right? And I forget the rest of what she asks. But yes, you would leave the patient covered in the middle of the bed, whether it's on their back or on their side, doesn't matter, in the middle of the bed in the low position, go wash your hands and give them the call light. Yes. So I hope that helps. Thank you, Caitlin. All right. So live game show. Hi, Wallflower. Congratulations. Oh, I'm so proud of you. That's awesome. So we have the game show on the 3rd Tuesday. So in 2 weeks, or I'm sorry, a week from tomorrow. These weeks are flying by for me. A week from tomorrow, we'll have another game show. So if you haven't tuned into those, you'll find them very helpful as you get ready for the state exam. And I write new questions for every game show. I don't recycle questions. I write new ones for every game show. So that's something that you'll probably want to tune in for to get yourself ready. And when we send you the after class wrap up emails, that is in there as well. Today is CPR in the afternoon from 2 to 6. Anybody plan on staying? So 1, 2, okay. All right. After today, we still do it twice a month. But after today, the price will go up to $55, okay, for my students. All right, from 2 to 6. Today is also the eclipse. So we'll take a break somewhere around 3:10 so that anybody that wants to go outside. I don't have the eclipse glasses, so. Yeah, you don't want to stare directly at the sun. It'll burn your retinas.
Where do you get those at? I suppose anywhere selling them.
Lowe's, I know, had them, but last I heard they were sold out. Yeah, I don't know.
When you get your letter back from Prometric saying complete, what next?
So application status, does it say complete?
It says complete.
And under FBI background, a little bit further down, does it say record found?
It has nothing.
Nothing there. Okay, that's good. That's good. So nothing or record found is what we're looking for. What you don't want it to say is record not found. So for you, that means they got your application, they got your payment, they found your background check in the filing cabinet. They put it all together. Now they're forwarding it on to the Board of Nursing. So 7 to 10 days, you'll get another email and it will have your test date. Very exciting.
Yeah, was your back down to a different place though?
I
Jessica?
went to UPS the same day.
Oh, you did do it. You did it. Okay, there. Okay.
It was worth it.
Okay. Yeah, just easier.
The scanner wasn't working. We stood there for like 20 minutes.
Oh,
Yeah, that's a
We were
problem.
both cracking up laughing. We were like, maybe I'm a serial killer in another state.
yeah. That happened to me last time I got mine done. Yeah.
Well, after COVID, we were all washing our hands so much. Your fingerprint, it was hard for them to get fingerprinting.
Yours went easy?
She
Yeah.
said, be careful out there. Your fingerprints are really nice. Thanks.
That's good. That's good. All right. So we have this workplace personality quiz. You guys are all starting to think now about where you might want to apply to work, what's right for you. We're at that point in the program where work stuff is starting to become a little bit important to you. So remember, I have this workplace personality quiz, and it will help you identify the best workplace for you based on your personality. So how many of you guys think that you want to work at the hospital?
I thought I did. I really thought I did, but I took the quiz and it says I'm best suited for pediatrics. I can't find any pediatric anything
Okay.
in this area.
So do you know where Friendly's Car Wash is?
Down
Yep.
Yeah.
Yep. You know where it, right behind Friendly's Car Wash is a place called TLC Medical.
Okay.
Go apply there. That is a daycare for kids that can't go to regular daycare. It is a medical daycare. TLC. Yep. So they actually hire people and send them to our class. They have a couple of different branches. So for those of you in South Florida, TLC is down there too. We just happen to have one here in our community, and they have physical therapy, occupational therapy, speech therapy services there. They have nurses, and they hire CNAs to help with the day-to-day care. But it's a school type setting, like a daycare, and they teach numbers and letters and colors, and they do education as well as the medical side. But if you've got a trach, a regular daycare is not going to take you. That's way too much liability. If you have to have tube feedings, a regular daycare won't take you. So these kids have to go somewhere, to get their education. And that's the role that this fills. Now, if you're interested in working in a home setting, Maxim Home Care, right here behind the Pink Dinosaur, just up the road from us, in that little plaza right behind the Pink Dinosaur, is Maxim, and they have a contract for pediatrics. There's another one in our community that also has a contract. I can't think of the name right now, but they do home care for pediatrics. Okay. Yep. So that would be a good opportunity for you as well.
So they would train you how to do a trach on
The nurses would handle that.
Okay.
Yep, the nurses will handle that. You are there to perform daily care and to notify the nurse when there's any issues.
And the nurse is on site?
At that place, the nurse is on site. In home care, your patients are way more stable. Okay. If they're unstable, then it would be a nurse working with that patient, not a CNA.
It has to be a stable person. That's part of it.
Remember, CNAs do normal, routine tasks on stable patients. Okay. Good. Makes sense? So yeah, everybody when they first come to class seems to think that they want to work in a hospital, and that may be a good goal for you. But that doesn't necessarily fit everybody's personality. And the worst thing to do is to jump right in to the deep end. This is a fast-paced environment. Your patients change rapidly, admissions and discharges. You've got nurses to deal with. You've got doctors to deal with. You have families at the bedside. It's a very, very fast-paced, ever-evolving, unstable work environment. And if you aren't secure in your skill level, you will drown. And what ends up happening is a lot of people go into the hospital thinking, I don't want to work anywhere else. This is all that I want to do. They get into the hospital and they drown, and then they leave healthcare.
And they probably would be really, really good, but they didn't have a chance to see how good they could be.
Right. It turns them off of medical. I don't want that to happen to you. If you pick the wrong place, understand that you picked the wrong place. You didn't pick the wrong industry. Try a different place. Okay. Good. Make sense? Please don't leave medical. We need you. We really need you.
I had a question about the certifications. Like, we go and we take the test. Do we get our scores back that same day?
Same day.
Do we
Yep.
get it back before we leave?
You do. Now, they won't discuss it with you. They're going to take your results. They're going to fold it over. And as you leave the facility, they're going to hand it to you, because they can't discuss those results with you. When you get out in the parking lot, you open it up. If both pages say you passed, you're a CNA.
So then at that point, you're certified.
You are certified. Now, your blue card, which is your actual certification from the state, comes in about 5 to 7 days. But in the meantime, 24 hours after you test, you can go online and just go to your favorite search engine, whatever that is, and type in Florida CNA license lookup, and you'll come to the MQA, which is medical quality assurance page, and you'll type in your name and it'll pull up your certification number.
So if
Your employer
was requesting that,
your employer will always verify through the database.
okay, so they're not going to ask us to bring in any type of.
They will, they're going to ask for your blue card, but they have to verify it. They have to independently verify it. And I'll explain why in just a second. This is super scary, but They have to independently verify it. Now, you can tell them, hey, I just tested yesterday. I got certified. I have my papers showing that I've passed both parts, and they can accept that. That's fine. But I don't have my certification number yet. And they'll work with that. That's fine. Because remember, when you get hired, healthcare, it's very rare to get hired and start the next day.
Depends on the company, right? The Solar Health, they did that. They're like, can we have your number proving that you have your, and I said, well, I'm about to take this. And they messaged me personally. They said, reach back out with that number.
With the
once you
number.
take it.
Yep. Yeah. And that can be, individual. Yes. But for the most part, most places will ask for it. But if you tell them, hey, I've got my papers showing I passed, they'll accept that. Because once you get hired, you have to go through orientation. You're not immediately put with patients in most settings. Home care is a little different. But in most settings, you're not immediately put with patients. You have to go through orientation. By then, you'll have your blue card. Okay.
I was reading that if we run out of time, for example, getting too nervous, taking longer than expected to finish each skill, we have 45 minutes, and if it rates 45 minutes, that will be that we are testing. Just the exam stops right then, and then we cannot finish.
Okay, so I want to talk about both sections independently. So let's talk about the skills first. Your skill, the amount of time you have for your skills is going to vary depending on the skill set. So if you, in your white books on page 25, you'll see the little clock at the top of each one. That tells you how much time you would have to do those skills. Okay, that skill set. So let's say that you're super nervous. What's the first one? Just give me the first one in the group. Okay. What's the second skill on that care plan?
Perform passive range of motion to rib, knee, and ankle.
Okay.
And dress a resident with a weak arm.
Okay. So we're doing respirations, range of motion, and dressing a resident. And we have how many minutes? 31 minutes to do those three skills. So let's say that with respirations, you're all nervous. It's your very first skill, and you have to do them in order. So respirations is first. What do we have to do first? Respirations. So you get really nervous because it's your first skill and you're starting to freak out and you can't remember anything and you're counting, but that's a whole lot of time for your mind to wander, and your mind starts to wandering and you lose count. So you start again and you start again and you start again and you start again. Okay, first of all, where's that evaluator want to be? In the pool with their Mai Tai. By the time you start over for the third time, they're rolling their eyes. Okay. So we want to try to have enough self-awareness that we don't restart the skill multiple times. But let's just say, for the sake of argument, we do. Okay. And then we do range of motion. It says hip, knee, and ankle, but we do range of motion on the shoulder. Should we ignore that? No. So we would have to start that over and do the right exercises on the right body parts. So now we've done that skill twice. And then we finally get to dressing a resident with a weak arm. And that's a longer skill. So we get to the end of dressing a resident with a weak arm. We've got the socks on. We've got the pants on. And the evaluator says 5-minute warning. Because they're going to give you a warning before your time expires. So they say 5-minute warning. Now your stomach drops and you're now in panic mode and you're freaking out. Oh my gosh, I've only got 5 minutes. So we've got socks on and we've got pants on. So what do we do now? Well, you've got 5 minutes to work with. How many of you guys can put on a shirt in 5 minutes? Sure. So let's speed it up. Okay. Let's get as many checkpoints in. So at the end of your time, when your time expires, it's not an automatic fail. It's just whatever checkpoints you didn't get done are going to count against you. So if you remember, let me pull it up. Ow. Hold on, guys. Okay, if you remember, where's dressing? Nail care, feed, foot care, occupied bed, sideline. There it is. Okay. Take a look at this. Okay. Half of those colors are red and green. Do you guys see that? Half of those checklist colors are red and green. What does that tell us? Green is for the
Opening,
and red is for the
closing,
closing. So which one's done at the end of the skill?
closing.
Closing. So look at all the red on there. Look at all the red on there. You can do the closing in 30 seconds. 30 seconds is all it takes. It's time me. Okay, let's go. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Bed is in the low position. Area is clean. Here's your call light. I'm going to open the curtain, wash my hands. My hands are clean. My skill is done.
20 seconds.
Okay. I just got all of those check marks. All of those check marks. Where we get in trouble is when we don't know the steps. Okay? Does that make sense? So get the blanket off the patient, make sure that they look decent, get your closing done. And even if you forgot, even if you don't get the dirty gown in the hamper, that's just one checkpoint. But look at how many we actually got with the closing.
How many checkpoints can you miss before you don't count?
So the answer to that is it depends on what you miss, because some checkpoints are going to count more than others. If we leave our patient at the end of the skill on their side, on the side of the bed, that's just one checkpoint. But is that important?
Yes.
Why? Safety, absolutely. So it depends on what you miss. That one checkpoint would fail you. Okay. Forgetting to put the dirty gown in the hamper,
So it gets back to
Nobody
what you said,
cares.
it's all about the patient. So if we're constantly
Okay.
thinking about what's best for the patient, that's what's going to be.
Remember, above all, it's set up like this for a reason. Okay. The foundation of everything we do falls on the care plan. CNAs do normal, principles guide performance. That keeps us in our scope of practice. That keeps us where we need to be. Above everything else, it's all about the patient and report everything to the nurse. Okay. So that house that you see here, it's set up that way for a reason. And you have that on your badge. You have it on every one of these posters, and you have it on your review sheets as well.
For example, like the example you used,
Yep.
dressing a patient, and I'm not able to do it on time, and my patient doesn't have the clothes on, so I would cover the patient, and could I act like I'm the work setting where and say oh, I have an emergency, so I'm gonna cover you to answer to this and do the closing
Right.
to come back.
Yep. I'm so sorry. I've run out of time. Let me get you situated. Yep. Very good. Very good. But I'm going to tell you a little secret. I've been doing this a very long time. I have not had any of my students in about 10 years time out. Just doesn't happen. Doesn't happen. It's way more time than you need. Way more time than you need. Just look at that skill set for a second. How long does it take to count respirations? Yeah, it's a minute of counting. You throw your opening and your closing in. You might be at 2 minutes, maybe 3. right? But they give us 5 minutes to count respirations. Range of motion, you guys remember how easy that was, right? Knee to the chest, back to the bed 3 times. Ankle, forward and back 3 times. Put an opening and a closing. That whole skill takes me about 2 minutes. You've got 4.
That will bring a little patient, right?
Right? So you got 4 minutes to do that. Dressing a resident, yeah, I can dress somebody in about 6 to 8 minutes. Right? Doing all the steps, 6 to 8 minutes. You've got, I think it's 14 to do that skill. Okay. So we add together the amount of time they give us for each skill. Okay. So if you go to page 71, I'll show you how this works. And I'll show you why you're not going to time out. Okay.
Do they stop the clock in between skills?
No, but let me explain what's happening. Okay. So if you look at page 71, in the middle of the first column, you'll see the graph that has all the timings for everything, right? So respirations, they give you 5 minutes. Range of motion, they give you 4. And how much time do we have for dressing? Is it 14? 14. So let's add those together. So what's 5 plus 4? What's 9 plus 14?
23.
Okay, but if you remember, we have 31 minutes. So where does the other time come from? Well, they give you an additional 3 minutes to wash your hands. That's in addition to the skills. They give you 3 additional minutes to wash your hands. So 23 plus 3 is 26. So how do we go from 26 to 31 minutes? They give you 5 minutes for transition. So this is the time in between the skills. I call it thinking time. It doesn't take the it takes roughly 30 seconds to move from one skill to another. They give you 5 minutes. So they over anticipate the amount of time for every single skill. Plus they give you extra time for hand washing. That doesn't count in your skill time. Plus, they give you 5 minutes to transition between the skills. So you're not going to time out at 31 minutes. You are not going to time out.
Well, is the evaluator telling who's going to be the patient first, or they're going to ask who wants to be the patient first?
They don't ask. So if you two go into the room, they're going to show you around. They're going to show you how the bed works, how the curtain works, where your supplies are, all of that. And then they're going to give you the care plan set and tell you you're going to be the patient for this. And while you're the patient, this is where I need you to be. And this is how I need you to act. Here's your care plan set. I'm going to read it to you. When you're ready to start, tell me you're ready to start. And that's when your time will start.
And the care plan said they're going to give you for all 3 skills you're going to be doing.
Right. Right. Good? Okay.
So would they, like, after you finish your first skill, and then you say you're done, then they give you 5 minutes to transition to the next one. They'll say, now start the next one, and you have to just let them know I'm ready to start the next one.
No, they're going to. So when you are done with your first skill and you say, my skill is done, she's going to say, okay, so you're the patient. So now I need you to get up out of bed and get into the chair. You can start the second skill when you're ready. And then at the end of the second skill, you're going to say, I'm done. And we're going to tell you, okay, you can get out of the chair and go stand over there. The next skill is on the mannequin. Go ahead and start when you're ready. I mean, it's literally a 5-second transition between the skills.
So the evaluator is going to let the
Think of the evaluator like the director of a play. So they're going to give everybody their marks, their scripts, all of that. It's not nearly as hard as you think it's going to be. It's not.
It's really helpful that you're going through everything now to prepare us ahead of time what to expect. I see that's really helpful.
It is, because what you fear is not the test. You fear the unknown. You don't fear the test. You fear the unknown. You fear your performance in the test,
Yes, that's
but you don't fear the test.
right.
Okay. They're not going to have you put your hand in boxes of spiders. I would fear that. Okay. This test, super easy compared to that. I compare everything to fear factor. If it's not as scary as fear factor, hey, it's a piece of cake. Right? You got to have your benchmarks, guys.
Yeah, that's a good way to look at it.
Okay. Could always be worse. All right. Any questions? All right. So let's get into today's lessons. First up, we're going to learn how to help somebody with a bedpan. Before we get to this, there is something that I want to go over with you that's not on my slides, but go to page 128, and I'm going to sum this up for you pretty quickly. Page 128 talks about HIPAA, and this is a lesson you probably want to read through on your own. You'll see that it's in the additional activities column of last week's lesson. But let me go through this really, really quickly, guys. Don't give any information about anybody else to anyone that doesn't need that information. It's that simple. Bless you. Don't share anybody's information with somebody that does not need to know it. And if you're not sure if they need to know it, don't share it. Who would we tell? The nurse. It's up to the nurse to figure out who gets what. Okay, so we don't have to make these decisions. We simply provide care and refer everything else to the nurse. Does that make sense? But sometimes we can unknowingly get off on the wrong foot here. For instance, if we have a patient who doesn't have any family in the area and a neighbor has been stopping by every day to visit with the patient, we see that neighbor every day, and we know that the patient just got a diagnosis that, you know, her cancer has returned and she's going to be transferred to hospice, and it's a very sad thing, and her neighbor shows up today, and you say something to the neighbor like, "Oh, did you hear about Martha? It's so sad. I'm so sad for her." That's not your information to share. Does that make sense? Sometimes the best of intentions can get us into trouble. Okay? So don't share anything with anyone that doesn't have a need to know. Okay. Let me tell you probably the most difficult position you will be in as a CNA regarding HIPAA is if you work in a dementia unit. The lines get blurred here, and you've got to be really, really careful. Okay. But this is probably for you guys the most difficulty you'll have with HIPAA, because in a dementia unit, your patients don't always have the ability to make good decisions for themselves. Okay. The decision-making capacity is gone. That's why they're in a dementia unit. And you may have a married man and a married woman in a dementia unit that start to cuddle up together. And you may think, oh, their families need to know. That's an ethical dilemma, isn't it? It's not our call. Who would we tell? And then the nurse and the ethics committee would make that decision on what needs to be relayed. Does that make sense? That is not your call. Good. Let's talk about celebrities. You will. Yes. Anybody know where John Travolta lives?
Tampa.
Ocala. Yep. Anybody know where J-Lo's mom lives?
I don't know. Right here in Spring Hill.
We have celebrities and their families in our geographic area. That's not a secret. No, we have them here in our geographic area. Ocala is not that far away. Tampa's not that far away. Orlando's not that far away. And people do vacation to little old Spring Hill now and then.
There's hidden gems here you never knew about.
Yeah.
The mermaids, the wiki-washi mermaids.
Yeah, the wiki washi.
Yeah. Yeah. One of the most famous baseball players lived in Citrus County. Yes. So we do have celebrities from time to time. Okay. Are we allowed to give any information to anybody about the care that they receive? No. Can we go home and tell our significant others about, oh my gosh, do you know who I saw in the hospital hallway today?
No, we should not.
Not supposed to.
No, that's right. We should not. They're people. They're people. And they're going through very, very difficult times, whether it's themselves or their family members. And we have to keep that in mind. They're not there for our entertainment at that moment. When they're up on a stage, they're doing their job. They're there to entertain us. But their personal lives are not there for our entertainment. And we tend to get that a little bit blurred in our society. We think that if you're a celebrity, that your life 24/7 is open to us. And it's not. And it shouldn't be. Okay. So be careful. You know, for me, the one episode that really affected me with HIPAA was Kobe Bryant. It was absolutely tragic. The EMS workers that responded to that accident took pictures.
Did they really?
Yes.
That's a different type of HIPAA violation.
Followed up by major lawsuits.
Yes. Major lawsuits. Absolutely.
The wife had sued.
That's right.
Is that the one
And
that
they
was-
should, with the helicopter.
and his daughter was with him?
Yes.
Yeah.
And they absolutely should have sued.
Yes.
And those people absolutely should have lost their ability to work in medical ever again. Absolutely. That is horrific. You should never capitalize on somebody's horrible tragedy. That's just unthinkable. Please do not be that person. Okay. So it's very easy. HIPAA is very easy unless you absolutely know that they have a right to know. Keep your mouth shut. That's HIPAA.
I just probably go to the nurse anyway, even if we think they can. I
Absolutely.
would just always go through her so I don't ever get liable.
Absolutely. That's your best policy.
Yeah.
So, and be really careful. You know, we tend to, CNAs tend to be very empathetic individuals, right? We're there to help. We always want to help. And a lot of times the family members will ask, especially at vital signs, well, what was mom's blood pressure today? And yeah, because if you answer that question, it doesn't, that is not the last question. That is the first question. That is never the last question. Because if you answer that question, oh, mom's blood pressure was 114/78 today. Oh, is that better? Or is it worse?
They're gonna wanna know more.
Is that good? Does that mean she's getting better?
You don't know those answers.
Oh, you do not know those answers. And if you're like, well, it's normal, you know. And then the doctor walks in 2 hours later with a terminal cancer diagnosis, and the daughter says, well, her blood pressure was fine today. Yeah, we know that the two are not related. Does that family know? No, and they may grasp for straws. Well, the blood pressure's fine. That means she's fine, right? That's denial, which is one of the stages of grief. So we don't want to give them information that can be misconstrued. Okay, good. So I bring up HIPAA when I talk about bedpan for a reason. My father-in-law was in the VA hospital many, many, many years ago, and the whole family is standing around the bed, and there are a lot of us, big family, whole family standing around the bed. CNA comes in and says, whole family standing there, did you move your bowels today? Oh, yeah. Is that appropriate? Is that appropriate? That's not, this is private. I did. Well, I said something to the nurse. Some sensitivity training probably is in order here. And then she said, do you want a bedpan? Do you want, you got to move. Standing at the bedside. Yeah. Talk about timing. Yeah. So we got to have a little sensitivity here, guys. Yeah. Very true. Very true. But once I reach a certain age. All right. So Anna says, do I have to wash my hands third time after I'm done with documentation after I touch the pen? Yes. Our standard is in skill with clean hands. So if you document, the very last thing you have to do is wash your hands. Yes. All right. So little sensitivity here with bedpan. Care plan at the top, page 148, says the resident has requested a bedpan. The resident is not wearing undergarments. Underline that. And is able to wipe self. Not wearing undergarments and is able to wipe self. And the resident can move as directed. So why is that important? There it is right there. So if you look at the bottom page 148, you'll see that this is, the bottom page 147, you'll see that this skill is going to be done on a live testing student. So that means that one of you may be a patient for this skill. Don't freak out yet. Just hold up. Everybody's giving me that look. Hold up. So for this skill, you are going to remain fully clothed. Somebody's going to put a gown on over your clothing and have you lay in bed. This skill is a simulation skill. They will really put a bedpan under your butt, but you're not really going to use it. Okay? You're not really going to use it. Now, the reason that this care plan says that the resident is not wearing undergarments and is able to wipe self, the reason this is in the care plan is because if you start trying to take the pants off of the person in the bed, the evaluator can say the care plan says they're not wearing undergarments. Don't try to take their clothing off. Well, yeah, you're going to actually keep your pants on, undergarments and pants. We also don't want anyone in your no square trying to clean it up. That's why the care plan says they can wipe themselves. So after they're done, right? After the skill is done, the patient has wiped themselves. So where's their hands been? Right. So do we want, and they're no square. So do you want them to pick up their tuna sandwich with those hands? So we need to give them a hand wipe to wipe their hands at the end of the skill. Yeah. Okay, so let's talk about that. Yeah. I'm going to, whoops. Hold on. I just messed up here. So I'm going to tell you that when a bedpan is in place, okay, when a bedpan is in place, give me a second. My thing may change here. I hit a button by accident. Okay, it stayed good. So when a bedpan is in place, this is a bedpan, guys. This is a bedpan. If it looks like a toilet seat, it's where the butt goes. Okay, so this goes under the butt. Imagine trying to sit on this. Not comfortable. So this part goes under the bottom. But your undercarriage, so when you're sitting here, your undercarriage, there's not much space between your undercarriage and the bottom of the bedpan. It's going to be hard to wipe. So in a clinical setting, even though our care plan is telling us our patient can wipe themselves for the test, in a clinical setting, they may need a little assistance, especially if they're a little bigger, right? Because, yeah, they're just not going to be able to get there to clean effectively. But for the test, they're going to make this super easy on us. All they're grading us on is putting the bedpan in place and taking it out and then cleaning it. And we clean it like we clean everything else. So this is not a hard skill. The important part of this skill, the thing that they're really grading us on, I'm just going to put this here for a minute because I'm going to come back to that in a minute. But the thing that they're really grading us on here has nothing to do with the bedpan itself. It has everything to do with the head of the bed. That is the important part of this skill. And let me show you why. The skill is 100% head of the bed. So if I've got a patient laying in bed like this, right? And I come along and I put a bedpan underneath the middle of that patient. What did it do to their middle? Raised it up. How many of you ladies can pee uphill? If it does come out, it's going to run right up your back and into your hair. Now, I don't know about you, but that's pretty high on my gross meter. Okay. Now, if you think urinating in this position is hard, how about a bowel movement? You're fighting gravity. It's not going to be effective. So when you put a bedpan under a patient, the most important step is to get them in a normal elimination position. We got to get them sitting up. Do you guys see that? And this is something you never would have thought of if I didn't bring it up, right? You cannot urinate when your middle is elevated.
So do you put the head of the bed up first and then put the bedpan, or you put the bedpan under first and then elevate?
Right. We need to put the bedpan under because when you're laying down, you can lift your hips. Put your feet on the bed. You can lift your hips up. Bedpan goes under, easy peasy. If you're sitting, all of you guys, without putting your feet on the floor, lift your butt off the chair. Without putting your feet on the floor, lift your butt off the chair.
You can't do that.
I have to use my hand.
Yeah.
Right, but even still, are you going to be able to get it up enough to get that bedpan under?
No.
No. So we can't put a bedpan under somebody who's sitting. Do you guys see that? You see that? So we're going to have the bed flat, put the bedpan under the patient, put the head of the bed up. After they're done, we'll put the head of the bed back down to take that bedpan out. Good? Questions? You had a question.
I think some people need to go back to school for that part because when I was really little, I was in the hospital for a week. And I had surgery to correct hyperpanic.
Oh my gosh.
Yeah, so I had a spinal fusion.
Oh, wow.
Well, I had to lay flat that
Right.
entire time I was there. The first surgery they put me through, I had a halo screwed in and it had a string with 15 pounds of weight on the end. So they had to keep
Right, yeah.
every time I had to go to the bathroom, it was laying
left.
Oh.
And I did not shower. I didn't get a partial bed bath. That entire week I was there.
Oh my gosh.
12 grade.
Oh.
12.
Oh.
Yeah.
Wow.
And it was at St. John's and St. Pete.
Yeah, St. Joe. Yeah, St. Joe's.
Sorry.
Oh wow.
Great hospital. The
Well,
staff
they
were
are-
amazing.
they
The
are
surgeon,
Okay.
was amazing.
So
Maybe not the CNAs.
out of all of that, so let's look at your experience for a second, right? So out of all of that trauma, and that is like a really big deal. So congratulations to you for overcoming. So, and 12 is old enough to remember, right? So out of that entire experience, what was the one thing that made an impression on you? Right? This is a traumatic, this is traumatic. I mean, this is a really big, this isn't, oh, I had a little burn or, a broken bone. This is very, very traumatic, right? So out of that whole thing, the two things that you mentioned, right, is a difficulty going to the bathroom because you had to, but not being bathed. So bad enough that this 12-year-old has this life-changing situation, a halo. Oh my gosh. And that's, yeah, that's a big metal cage strapped around you and screwed into you. Yes. Yeah. And rests on your shoulders. Okay. With traction. Right. So that's bad. That's horrible. She hardly talked about that. That is horrible. Horrible. She hardly talked about that. What she brought up is the human component. Right? So in this situation, thankfully, the surgeons were fantastic and the nurses were fantastic and they did their work. They did a good job. That's great.
They had emotional support nurses in there too to, calm me down before surgery and whatnot. It was all amazing.
Amazing.
They were great people. They're not the CNAs.
Okay. But the one thing that made an impression on you is the fact that your basic need to be clean wasn't met.
And at that point, I didn't know anything, so I just thought, well, because I was bedbound, there was no way for me to be clean. I didn't know of such a thing as a partial bed bath. I
Yes.
was 12.
Yes. And especially at 12. So had I been writing that care plan, 12 years old is the beginning of pubescence. Okay. Beginning of puberty. So your body is changing. Nobody wants to be looked at when their body is changing. Think about all the privacy you suddenly adopted when you became 12, right? So very, very private. Yep, that's right. Because our bodies are changing. And we're not comfortable with that. Not comfortable, right? But you also are developing odors, adult odors, right? And to be aware of that and not have anybody help you with those things, now you're becoming much more aware, and that's going to affect you psychologically way past the actual event. So as a nurse, I would be aware of that, the psychology of how important a bed bath would be at that age, and to minimize exposure while I'm doing it and put all of these things in place to make sure that their needs are being met with minimal intrusion. Okay, that would be an important part of the care plan. This is why those of you who go on for nursing, care plans are so important, because CNAs can't make care plans, can they? But if it wasn't on the care plan, what should the CNA have done?
Talk to the nurse.
Yeah, hey, this poor girl hadn't had a bath in 2 days. Should we be doing something about this? Maybe hit the high points?
So in a case like that, the nurse was the one that dropped the ball.
So either the nurse dropped the ball, and that's kind of where I'm because the nurse is ultimately responsible, regardless of whether, the nurse is ultimately responsible. So the nurse, to me, dropped the ball. if it wasn't on the care plan, the CNA should have brought it to their attention. If it was on the care plan, the CNA should have performed it. But ultimately, who does the liability lie with? The nurse. Yeah. So that's why I'm laying this at the feet of the nurse. Absolutely. Yeah. So this is kind of crude, so I hope I don't offend anybody. Okay. But if your patient can't be bathed, okay, there is something called a PTDB bath. Okay. PTDB bath. And what that means is we're cleaning all the stinky parts, the pits, the tits, the dangly bits. Okay. PTDBs. Yep. Yep. But it's true, right? These are the areas that need to be cleaned up. If we're not going to like clean the whole body, then we at least should clean the hot spots, right? Okay. The pits, the tits, and the dangly bits. Yep. 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 You won't forget it. Okay. So, this skill, if you look at the bottom, you'll see all of our supplies here, but I want to talk about barriers for a second for this particular skill. So you'll see that I have a chucks there for a barrier, and then I have one for under the patient. Now I'm going to tell you, I'm going to show you this video in just a minute, but I'm going to tell you that I personally do not use a chucks on the table for this skill. And there's a very specific reason for that. You can, and I want to be very clear about it. You can put a chucks on the table and put all your supplies on the chucks just like we do every other skill. I have a problem with it because this is my patient's dining room table. This is where they're going to eat. And even with the chucks on the table, I don't like putting waste items on the table. Okay. If you put a urinal on my dining room table, I'm going to have a problem with it. Okay. So for me, I do this skill without using this table at all. I just open my drawer. Everything I need is right there. I just open the drawer. And when I'm ready for the item, I just reach in and grab the item and put it under the patient. Grab the toilet paper, hand it to them, right? So I don't use my table to stage the skill.
For the test,
you don't have to.
Okay.
You don't have to. But I know that I've taught you up until this point to use the chucks and put all your supplies on the chucks. And if you want to do that, I'm giving you the freedom to do that for the test. It's okay, as long as you're using a barrier. But I'm going to tell you, I don't. Either way is fine for the test. Okay. Does that make sense? So I've got it here on your supply list, but it is optional. Okay. Good. Okay. So you know all these steps already. There's really not much to teach you here, right? Remember, we have to read the care plan. Care plan tells us the resident is able to move as directed, so we can ask them, lift your hips. Easy. Now, if they can't lift their hips, then we're going to roll them on their side, put the bedpan up against their bottom, and roll them back onto it. Okay. At the end, after they've used it, you don't want them to roll off of it, because what's going to happen to that bedpan? So we have to hold the bedpan down as they roll off of it. Okay, good. Now remember what I showed you here with the bedpan. So for the test, just ask them to lift their hips. It's way easier. Care plan says we can. Let's take the gift they give us here, right? But I want to talk to you real quick about this. So remember when we put the bedpan under the patient, we had to put the head of the bed up? And then after they used it, we had to put the head of the bed down. This is not that deep. So when the patient urinates into this and we're moving the head of the bed, it's going to slosh. So what could we put on the bed if this sloshes out that would keep our sheets clean? Yeah. So the first thing we're going to do when we're using a bedpan is to put a chucks underneath the patient. And then we're going to put the bedpan under the patient on top of the chucks. Now, at the end of the skill, when we put the head of the bed back down and we go to remove this, we're going to take the chucks with it because I cannot carry an open container of urine through a room. That's a privacy violation. Nobody needs to see what's in here. That's privacy. But it's also infection control because if my shoelaces come untied and I trip and I'm carrying an open container of urine, okay. Remember that most of my wet body openings are located right here. I do not want to put them face first into somebody's human waste. Okay. So we never carry an open container of urine through anywhere. So we're going to cover it with the chucks for transport. Does that make sense? Good. Okay. So I'm going to tell you 2 tricks you can use in a clinical setting to make this skill 1,000,000 times easier. You're not going to use them for the test. So I'm going to give you 2 tricks for a clinical setting. You've already got this written down in your book on page, what is that page with the toilet seat? Yep. 146. So I'm going to tell you these tricks, but let me explain to you a little bit about physics. Okay. You've got a bedpan. You have a patient sitting on the bedpan that's kind of drooping down into the bedpan a little bit because of physics, right? And you've got urine coming out under pressure. Doesn't dribble. It comes out in a stream. So when you have a stream of urine this far from a flat plastic surface, you're going to end up with splashback. The whole undercarriage is about to get wet. Okay. Everybody with me? That's going to make cleanup a little more problematic for our patient. For the test, care plan says that they can wipe themselves. We're not worried about it. They're going to take care of it, not our problem. But in a clinical setting, your patients aren't going to be able to wipe themselves, especially with a whole wet undercarriage. There's a whole lot there to clean up, right? So there's something that we can do to help that. If you take toilet paper and you make big loops of toilet paper, big loops, 4 or 5 big loops of toilet paper, and you lay it down in the bottom of that bedpan, it absorbs the urine. Now we don't have anything sloshing around, and our patient isn't, when the stream hits the toilet paper, you're not going to get that splashback. Now, if our patient is on intake and output measurements, you guys remember talking about intake and output? Where we measure everything that goes in and everything that comes out. If our patient is on intake and output, can we use toilet paper? Because it will absorb it. Yeah. So what would we need to know before we can use toilet paper? If they're on I's and O's. That's right. Make sense? Good. So if our patient is on I's and O's, we can't use toilet paper. We can ask the nurse, hey, can I use toilet paper? Good. Now, the other thing that you can do to make this skill so much easier on you, anybody ever sit on a leather or leatherette car seat with shorts? Okay, you stick to it. That's right. And then you kind of have to peel it off and layers of your skin get left behind, right? It hurts, right? Okay. What is our body temperature? You got a bare butt sitting on plastic that's at least 98 degrees. What do you think is going to happen with them sitting on this plastic for a fair amount of time? When we go to take this out from under the patient, what's it going to do? It's going to stick. Yeah. And we're going to have a hard time getting it out from under them. And whatever's in here is probably going to spill. So how can we avoid that? Well, again, we have to ask the nurse. Okay. This is a nurse thing. But if you take a little bit of cornstarch or the cornstarch baby powder, little talcum powder, and you just put it right here on the surface. It will help prevent it from sticking. But if our patient has a respiratory condition, we cannot use powders because it irritates the respiratory tract. If they have a wound in the area, we can't use powder because we don't want that powder near the wound. Okay, so can we just use powder anytime we want to?
No.
Who would we have to ask?
Nurse.
The nurse. So if I am assigning a bedpan, I'm going to ask my nurse 2 questions. Okay. So as the nurse, if I'm assigning, I'm going to put it in the care plan. If I'm a CNA and got that assignment, I'm going to ask the nurse, can I put toilet paper in and powder on? And that's going to make this a much nicer experience for your patient. Make sense? Good?
Can I ask you a question?
Yes.
And this is probably a dumb question, but is this bedpan for bowel movements and urination for females, and then males have the urinal if they need to urinate?
Right.
Is that how it's done?
That's right. So this is going to be used for bowel movements, both sexes,
Right.
urination for females, and males have something that looks like a milk jug
Right.
that we use for urination in most settings.
Okay.
Not all,
Right.
most.
Okay.
Okay. So let's go through, this is called a decision tree. Okay. So we know, and we talked about this on day 1, right? I said the very first thing I need to know about each patient is how they're going to toilet. You guys remember me saying that? Because every patient has to go every shift. That's the first thing I always focus on is toilet. Because I know that's an immediate need. And chances are they're probably going to have to toilet while I'm figuring this out. Because that just always happens. So as a nurse, I've got to look at a couple of things here. Now, most of the time, this decision has already been made for me because it's part of the doctor's orders. But if not, if the doctor isn't familiar with the patient and needs my input, I've got to go through this process. So either the doctor goes through this process when they're writing orders, or I, as the nurse, have to go through this process to make a recommendation. Good. The RN. Good. Understand that? Did I say CNA anywhere in there?
No, you did not.
Okay. Very important that you understand that because toileting is done by doctor's order. So as a nurse, I can make a recommendation, but toileting is a doctor's order. I'll explain why that's important in a minute. First question I'm going to ask is the patient even continent? Can they hold their urine? Are they in control of their bowels? Are they continent? If they're not continent, then we're just going to do pericare every 2 hours. Easy peasy, done. End of story. Okay. Remember we talked about pericare, right? But if they are continent, okay, now we've got some decisions to make. So the first thing that we need to know is, can they get up and go to the bathroom, either with or without help? Now, all of you guys, you can get up and go to the bathroom anytime you want to. So we call that bathroom privileges. You just get up and go. I don't want to be involved. I don't need to be involved. Just go, right? That's what we want, right? Bathroom privileges. But if the patient can't go to the bathroom, either with or without assistance, for whatever, maybe they're laying in bed in traction, right? Then I have to figure out, is it possible to use a bedside commode? Now, the reason we want to go there next, bedside commode, is because it still gives that normal elimination process. They're upright. They're sitting on something with a hole in it, right? The body knows what to do with that. Okay, good. Makes sense? Okay. If they can't use a bedside commode, either with or without assistance, because they've got traction and a halo, right? Now we have to look at, well, what are our other options here? Well, certainly we can use a catheter. That might be a good option for a situation, at least to handle the urine part of it. But it's not a great option because there's a lot of risk with catheters, which we're going to get to in the next skill. Remember I said this is all doctors and nurses. Doctors and nurses. But I'm leading you through this on purpose. Okay. So as the nurse, my doctor didn't give me an order, so I've got to make a recommendation. I'm going to figure out, is the patient continent? If they are, can they get to the bathroom? If they can't, can we use a bedside commode? If they can't, is a catheter appropriate? Okay, so I'm going down this list. If a catheter is not appropriate, because it is very high risk, and we'll talk about that in the next skill, if this is not appropriate, the only thing I have left in my bag of tricks is a bedpan. Did you notice that that's the last on the list? I had to go through all of this first. The reason for that, this is very important. The reason bedpan is last on the list is because you have been trained since you were this tall, don't pee in the bed. Don't pee in the bed. Don't pee in the bed. And certainly don't poop in the bed. You have been trained. Now, what do we know about memories that are made early in life? They stick with you. That's right. So these are high quality memories made by a really good memory factory. Just because I put a plastic pan under somebody's butt does not mean their brain is going to let them go.
She had complete control of her, and she was really fragile because she was on hospice. I kept offering her, a bedpan or just to change her rate. She would not. It was a very long process, but she wanted to go. It was ingrained in her to stand, sit, and go to the bathroom. That's right. I couldn't talk her out of it. Yep. And that's because the memories that we make early in life are going to stick. But even with two broken hips, 101 years old, less than 100 pounds, she still wanted to stand to go to the bathroom. Yep. Yep. That was insane. I know this is where becoming a caregiver gets hard, because we know there's an easier way. Let me put a bedpan under you. It's easier, but we have to balance that with the dignity of the patient, right? And those two are not always on the same playing field. So yeah, in that case, I know it's super hard. She's 101, super fragile. But in that case, getting her doing a pivot transfer onto a bedside commode may be your best option. But yep. And that was important to her. And that would have been important to my grandmother too. How many of you guys right now, if I told you, our bathroom's out of order? So sorry, guys. I've got some adult briefs over here. Go ahead and yeah, go ahead and put your adult briefs on and just pee in your pants while we're in class today. Yeah, most people wouldn't. Yeah, most people would just walk out. That's, not something I'm going to do. So we have to understand that your personal dignity is often ranked way higher than physical comfort for a lot of people. Okay. Does that make sense? We tend to forget that as caregivers. We do. We tend to forget that because we just want it to be easy. Right? But personal dignity is going to rank higher for your patient. Good? Makes sense? So a lot of women that give birth, a lot of women, they are a little hesitant to have a bunch of strangers down there watching everything that's going on, right? Now, those strangers are healthcare professionals. They've seen it all. There's only a few varieties here. We've seen them all, right? It's not going to really impact us too much. But do you think that that matters to the person who owns that thing that we're looking at? Okay, personal dignity ranks high. Does that make sense? Okay. So do we understand that bedpans are a last resort? Do we understand that our patients may have a psychological restriction when using a bedpan?
that means that you may put a bedpan under a patient and get no results. 15 minutes go by, you go in, are you done? Can we take that bedpan out? No, I wasn't able to go. Okay, no problem. Let me take the bedpan away because remember, this is cutting up into the patient. Let me take that away and let's try again in a half hour or so. Okay. Be compassionate. What you don't want to do is go, are you kidding me? You've been on that thing for 15 minutes. How long does this take? And then they call 20 minutes later and say, I need to try to use a bedpan again, and you get an attitude with them. I just put that thing under you. Is that how we should respond to this? We need to understand that your patients may not be able to use the bedpan the first time you put them on it. They just may not be able to. But there's a few things that we can do to help. I'm going to ask a very personal question. When you are in a public bathroom and you have some intestinal difficulties, and you are in the public bathroom, and there are people in all of the stalls, what's happening, right? Yeah, we aren't comfortable with everybody in the world hearing all of our bodily noises, are we? Okay, our patients are in a room with a roommate, a complete stranger that they have to converse with for however long they're there. Do you think they're going to be comfortable making all kinds of noises in a bedpan? So there's also odors that go with that. So if possible, let's evacuate the room for them. If you can take bed A for a walk, this is the right time to do that. Get bed B on the bedpan, wash your hands, and tell bed A, hey, let's go for a walk around the nurse's station. Come on, let's go. Okay? Evacuate the room. You can also use an odor eliminator, air freshener or some sort of odor eliminator proactively before the event. You can turn the water on because the sound of water can help with the urinary reflex, but it also helps mask sound, right? There's some things we can do to make this easier on our patients and relieve some of that psychological restriction that we're going to encounter. Does that make sense? Good? Okay. All right. So the reason that I'm explaining to you that this is a doctor's order, nurses may have some input here, but it's ultimately a doctor's order, is because increasingly I am seeing CNAs that take it upon themselves to go grab a bedside commode and bring it to the bedside and transfer the patient onto the bedside commode because the patient doesn't want to use a bedpan. Is that an appropriate action for a CNA? It's not in the care plan. That is correct. Do you guys understand that? That is not a decision you are allowed to make. Absolutely. They may have a halo and 12 pounds of traction. They may have just had a lumbar puncture or spinal tap, and they have to remain flat to release the intracranial pressure. That way that the spinal fluid doesn't escape through that hole. They may have just had a heart cath, and we don't want to dislodge the plug that's in their main artery in their leg or arm. There's a lot of reasons why patients may have to stay in bed flat. We have to watch those care plans. This is all part of preventing medical errors. I'm actually doing a course on prevention of medical errors. And, you know, every slide has the same 4 words on it. Follow the care plan. Every slide, same 4 words. Follow the care plan. That's how we prevent medical errors. That whole half-hour course can be summed up in 4 words. Don't make decisions. Okay. So remember that clean rolls toward me, dirty rolls away, right? So that's how we're going to put the chucks under the patient. We'll roll it toward us, have them lift their hips and unroll it under them. After we get the chucks under the patient, we'll position the bedpan. Remember, the wider end goes under the butt part. Make sure it's under their butt, because when you elevate the head of the bed, that is right on the crease. That's a part of the bed that's going to bend when you put the head of the bed up. So make sure it's in the right spot, because as the bed bends, it's going to shift a little bit. You can tell the patient they can adjust it, but you want to make sure it's in the right spot. Otherwise, it'll end up under their back, and that won't help them. We want to make sure we put the head of the bed up. Do we want to touch that bed controller with butt juice gloves? Remember, where have your gloves just been? Under the patient. Those are butt juice gloves. So do you want to touch that controller with butt juice gloves? No. So take your gloves off. We're going to give them their toilet paper and call light. Remember, it says they can wipe themselves, so we're not involved in that process. And then for the test, we're going to step on the other side of the curtain. We have no other patients for the test. This is it. This is our only patient. This is all we have. So for the test, we're not leaving the room. If we're not leaving the room, we don't have to wash our hands. We're just going to stand there and wait. In a clinical setting, please do not stand there and wait. They cannot go with an audience. Wash your hands, leave. Go take care of somebody else. Go answer a call light. Go walk a patient. Go do something. And then when they're done and hit the call light, we're going to come back in, wash our hands, and put our new set of gloves on. Okay? You guys got it? All right, we're going to lower the head of the bed, preferably before you put your gloves on. And then we'll put some gloves on and remove the chucks and the bedpan together. We're going to wrap that chucks around the bedpan for transport. We'll take it to the bathroom. We're going to dump it in our bedside commode or toilet, whatever you have in the testing area. And then we're going to rinse it. Dump the rinse water where? Okay. And then store that bedpan like we store everything else. Take your gloves off and give the patient a hand wipe. Yeah. Remember, their hands have just been where their hands have just been. Then after that, or anytime after you remove your gloves, you can take your privacy blanket off, restore the sheet, and do your closing. Now, I do want to talk about this. This is a bedpan cleaner. You'll see this in clinical settings. Looks like a little shower head standing up. If you pivot that forward, it will start spraying into the toilet bowl. And that is a bedpan cleaner. You just take the bedpan and let the water clean it, dump it right in the toilet. It is a great bedpan cleaner, but we have water under pressure hitting a flat plastic surface. So we're going to get splashback. So you don't want that on your uniform or on your face. So if you're going to use a bedpan cleaner, we have to dress for success. We're going to use one of those yellow isolation gowns over our clothing. That way, if any urine or fecal matter splash, we're going to remove it and get rid of it. So we're not taking it from patient to patient. And we're also going to use a mask with a face shield to cover all of our holes so nothing flies into our holes. A word about masks. Medical masks do not help with odor. Okay, they do not filter out odor. They filter out particles. So don't think that by putting that mask on, it's going to help with odor. It won't. But I will tell you what does. Go get a little thing of Vicks. You know the stuff Mom used to rub on your chest when you were sick, right? And just put a little dab underneath each of your nostrils, and that will help cut offensive odors. Now, me, I can't use Vicks because I have very sensitive skin. I'll look like Rudolph. I'll turn instant red. So I take Vaseline, little jars of Vaseline. The Dollar Tree used to have them, little jars of Vaseline, and I put a couple of drops of essential oil in there. I like lemongrass or orange blossom, but you can, whatever essential oil works for you, mix it up, and then you can use that as well. So those are the ways that we help deal with offensive odors. Masks don't really help with that.
I have a question. If you, when you're doing that, do you do that before you go into the patient's room then? Or when are you doing that? And gowning up with that yellow gown? Right away, the first thing, that's what you're doing?
Yeah.
Okay.
Yeah. Before I take the bedpan out, I'll put the gown on.
Right.
Yeah. After a while, the offensive odors don't seem to affect you as much as they used to. You tend to develop a little more tolerance to it. But when you're new, it probably will affect you. So that's a really good. On a side note, so a friend of mine and I are actually starting a new company, and we're making items to add to your bath to help with muscle soreness and joint problems. So it's a special proprietary blend that we're doing, but we're using oils, essential oils, to scent these things. So I have been nose deep in essential oils for yeah, because we're trying to develop our proprietary blends of these essential oils. And let me tell you, this has made a world of difference in me, because it actually penetrates and helps with my, you guys all know I have a knee problem. So my stiffness, my soreness, and I'm noticing that I'm actually getting a little bit better.
So you put it in bath water?
Yes. Yeah. So it's very, very interesting, but I'm very aware of the effect of scent on experiences. So find a scent that works for you. Menthol is not it for me. Vicks is not it for me. All right. So make sure that you get that position, that bedpan positioned appropriately. All right. So any questions on bedpan? I'm going to show you the video for this because it has good close-ups. Any questions? No? And then after the video, we'll take our break.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
Wonderful. I understand you need a bedpan. Can I assist you with that?
Sure.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, I'll need a Chucks and a privacy blanket for this skill. Okay, Mr. Jones, I'm going to place this privacy blanket over you. This will help keep you warm and protect your privacy as we do this skill. Is that okay?
Yes.
Okay. I'm going to spread this out without snapping it or shaking it. And I'll have you hold this in place so I can pull your sheet down. That way your sheet remains clean as we do this skill. Okay, I'm going to prepare a Chucks to place under you before we put the bedpan in place. I'm going to hold the Chucks up lengthwise and roll it toward me. Clean rolls toward me, dirty rolls away. And I'll just place this on the bed. I'm going to open the drawer that the bedpan is in and get a set of gloves. Okay, Mr. Jones, in just a moment, I'm going to ask you to bend your knees, lift your hips as high off the bed as you can, and I'm going to unroll the chucks underneath you. Okay?
Okay.
All right, go ahead and bend your knees and lift up. Okay, and you can relax. I'm going to go around to the other side of the bed and unroll it. Okay, Mr. Jones, can you lift up again, please? I'll smooth the chucks out, making sure it's positioned properly on the bed. You can relax. Okay, now I'll get the bedpan out from in the drawer. And I'm going to place this under your bottom, if I can get you to lift and relax. Is that comfortable?
Yes.
Okay, I'm going to put the head of the bed up, but let me remove my gloves first.
Okay.
Okay, I'm going to put the head of the bed up. Please tell me when you're comfortable.
Okay.
And you may have to adjust that bedpan a little bit as it moves. Tell me when you're comfortable.
That's good.
Okay, here's your toilet paper and your call light. And I'm just going to wait out here. Please let me know when you're done. Okay, Mr. Jones, I understand you're finished. Let me help you with that. I'm going to put the head of the bed down now. And please do not lift your hips. Once the head of the bed is in the lowered position, I'll put on a pair of gloves. And I'm going to hold that bedpan flat as you lift off of it. Okay, Mr. Jones, I'm going to take a corner of the chucks and hold the bedpan flat as you lift off of it. You can go ahead and lift on the count of 3. 1, 2, 3. Thank you. I'll remove both the bedpan and the chucks and take them to the bathroom for disposal. I'll be right back. Once I get over here to the bathroom, I'm going to unwrap the bedpan and we'll throw the chucks away. I'm going to empty the contents of the bedpan into the toilet, and then I'll rinse the bedpan. We'll deposit the rinse water into the toilet as well. And then we'll set the bedpan down to dry. I'll pick it up with a paper towel. I'm going to dry the inside. We'll throw that paper towel away. I'll dry the outside, throw that paper towel away, and get one for the drawer. Okay, I'm going to place the bedpan in the drawer along with the toilet paper. And we'll use the paper towel to close the drawer. Now I can remove my gloves. Mr. Jones, would you like to wipe your hands? Thank you. Okay, you can relax your legs if you'd like. And I'm going to pull your sheet up and remove the privacy blanket. We want to make sure that we roll the blanket in a ball so that any trailing edges don't contaminate other surfaces. There you go. Here's your call light. I'm going to go put this in dirty linen. I'll be right back. Okay, Mr. Jones, are you comfortable? Is there
Yes.
anything else I can get for you while I'm here? A
No.
magazine,
Thank you.
perhaps? Your call light is there. Please let me know if there's anything that we can do. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
All right, any questions?
Don't we need to wipe the call light because he used it to call us back?
How do I put this? Nothing in the patient environment that they touch routinely is considered clean. If it's visibly dirty, then yes, you would want to wipe it off. But if it's not visibly dirty, then no. I know I would like to keep patient environments a whole lot cleaner, but the problem is there's a patient there.
Right.
And when there's people, it's never dirty, or it's never clean, it's always dirty. Somebody have a question?
It clips.
Yeah.
Cue the sound. So.
Let's go ahead and take our break. Come back in 15 minutes.
Right. So your appointment date is Wednesday at 4. Yeah, level at 2, federal naval adjustment. Yeah. Yes.
I didn't read Brenna on that thing. See, here's the paper.
Yeah, pending approval means that it went to the state board.
Then I got a separate. It's in red, it says there's a column with requesting additional information, you will receive a list of required documents. It was in yellow.
Okay, then you're gonna have to wait to find out what they need from
Okay.
you.
Alright.
Yeah.
This is what they gave me.
See, if I go back on UPS, UPS was the one that gave you that.
Mm-hmm. Yeah, my fingerprint has mine.
Yeah.
That's what they gave me. They gave me this 3 years ago, so I don't know if it's the same now.
My mind says I see what I got.
Okay.
I didn't get anything.
No,
They didn't give me anything, no.
that's crazy. I mean, I mentioned to her last week too, and she was like, it was surprised because they're not supposed to, but they gave me that 3 years ago.
Maybe they changed it since then,
Yeah,
cause I
maybe.
just did mine last Friday and they didn't give me anything.
That's crazy. I don't know.
Did you get back some sort of email, something? Nothing at all?
They just sent me an email confirming that they, like, my fingerprints
That it
were
was
sent. That it was completed, but I didn't get like a piece of paper back
Mhm.
with proof that I've had a background check.
That's crazy.
I haven't gotten any proof back or any background checks that I've ever done. Cause it's the third one that I've had to do for a job or school or something, so I've never gotten anything back.
I hope I can use mine. Now I'm gonna have to go do it again, but.
Yeah. Jessica, the other lady told me that we're bringing stuff
Oh,
Wednesday,
yeah,
and you're bringing.
Yeah, Wednesday's Hungry Howie's special, a large pepperoni, large cheese. I figured I'd get one large cheese and one large pepperoni, and if someone else could bring drinks, and then someone else wants to bring a dessert, we have enough for, that should feed everybody.
Do you think they have chicken pizza? Because then I'll help you with pizza, and then because I'm
Okay. Baking pizza eater.
mm-hmm.
I love pizza.
I don't,
It's my favorite.
I'm a creature of habit. I don't do extra anything. I don't know. I'm sure Hungry Howie's has like a chicken pizza maybe.
They might have like a barbecue chicken pizza or something where you can customize it and make it your own.
Yeah, they may have to go on the website and look, see if you can customize.
I have their
Places
app.
do that.
I can look.
So those two maybe can help you. And then we got, I don't know, maybe one or two.
Yeah, it's $7.99 for one large pepperoni or one large cheese, but you don't, like, if you add extra stuff to it or whatever, you pay extra. And I don't have a lot of extra right now. I just wanted to do something for lunch for everybody to say, thank you. But then if someone else could bring like a gallon of sweet tea from Publix and a 2-liter of soda.
We can do that.
Also Jessica, she said she's bringing drinks.
Bring drinks.
So she's gonna do the drink.
Maybe someone wants to do like,
And the other lady, I don't know her name, but she said she's bringing cookies.
some
And
dessert.
So then it's
Sarah is bringing salad.
Is this for Wednesday?
Yeah.
Oh, okay.
It's our graduation. It's up to us.
No, I didn't know
Thing.
you.
Yeah, I don't know.
This is the first time I'm hearing about it too,
Yeah.
but
So we have everything but
cookies,
Utensils.
drinks,
We need
salad, pizza.
utensils, plates, cups, and forks. I use forks.
I could bring some utensils.
Did someone say they were gonna do that? Okay.
I think we should all be talking as a group so we can.
Before we leave today, let's get a piece of paper and give me the
Yeah,
names of
yeah,
everybody
yeah.
and their phone numbers so that I can call them Tuesday and be like, hey, were you airhead like me and forgot?
Make sure.
My life is too busy. I always forget things. But yeah, that sounds good. Wednesday's our last day together.
I am moving.
You're moving Wednesday?
Not Wednesday.
Oh.
I am moving by the end of this month.
Out of Spring Hill or?
Mm-hmm.
Oh,
I'll be going to North Florida.
okay.
That's where my boyfriend lives. All the way up there. 2.5 hours away.
Taking the plunge and moving in with your boyfriend?
Yeah, there's a school up there that I want to go to for nursing. My best friend goes there.
Okay.
So I'm gonna go up there for that, and it'll also let me save some much gas money because 2.5 hours there and back every weekend requires a lot of gas.
Mm-hmm. Hello? Good. I'm on break in class. I thought- Mhm. Maybe like around 3.
Mhm.
Yeah. All right. Yeah, I could probably get him around 3 or 3:30. Right. Before you move up there though, I would have him put a ring on it. Like, don't do it before he commits. Okay. I won't be able to pick him up today. I have a couple shifts after school. Alright, I gotta go. Okay. Okay. You ever have that friend and they don't understand like the meaning of the word friendship? Like you're the friend that they always go to and ask for, but when you need something, it's like a huge inconvenience.
Mm-hmm.
Yeah. Like if I asked her Friday, hey, can you get my kid and take him home for me so I can pick up the cup? No,
I'm busy.
This. Like we're tired.
Yeah, those are the people that I don't stick around.
When you've been primarily a stay-at-home mom with 4 kids for 13 years, you don't have a lot of friends. Like I'm not the friend that gets called to go out. I'm a friend that gets called to watch the people's kids while they go out. And I'm okay with that. Like I'm not a big party person. I have like what I think common sense, and I enjoy reading a book, watching Netflix or something.
Yeah, I never was a big party person until I
But-
met the people that I felt comfortable.
Well, that's my friend.
being with.
She's nice. I've gone out with her a couple times, but it's not my scene. But she has 5 kids, and we met 8 years ago.
Mm.
We met, and so I've seen her like through like, her last walk of life.
Mhm.
Through the divorce, she got 5 kids. Single mom. She met this new guy. She's been with him for a while now. They seem happy. But I don't want her to try and jump at the what ifs anymore.
Yeah.
Exam question. What are your expectation and earnings per hourly position? $25,000.
I wonder how Wednesday is gonna go.
What do you mean?
Does she still teach that day?
Yeah, I think we'll probably have like maybe like a review is what I'm thinking.
Yeah.
So I can't see us eating lunch for 6 hours.
No, I think we're just gonna that whole interviewing. We're gonna
Oh yeah, that's right.
start
Our
interviewing.
resumes, the questions,
Okay, she's gonna have
interview
us.
process.
She's gonna help us create
Any
the
additional practice
answer to the question. Tell me about yourself.
Oh yeah,
The handicap question.
I've got like
That
20
question
applications.
sucks. I didn't want to start sending in applications until I at least had a test date.
My resume is stupid. I have all of the experience without the official certifications and qualifications for a lot of stuff.
Yeah.
So I have the experience, but I have to start now going and getting like specific licensing or certifications for all these things that I've been doing for all these years. You know.
So on the schedule it says graduation class photo and review and then practice time.
Ooh, gotta put makeup on Wednesday.
I know, babe. Yeah.
And I can tell you always look very nice together.
Thank you. And I only had an hour to get ready this morning.
I got myself ready while getting my 4 kids ready for school.
I was late.
I was late. I came in 10 minutes late today. I was like,
I came in 5 minutes late. I'm never late.
responses.
One of those two girls, she was never here on the first day.
Yeah, well, she's missing today. I don't
Yeah.
recall her name.
She comes sometimes. It starts with a J, I think. And then there were two other girls sitting over here. One that was in that chair kept falling asleep.
I didn't pay that much
And the one
attention.
that was here was like really quiet, like didn't say anything at all. The entire class.
I don't remember. I don't remember.
Oh, the first,
You remember
the
that?
first time, yeah, she was sitting right there.
She came in late, right? Like last or something.
Uh,
She had like reddish or brownish hair.
Yeah.
The one that was sitting here.
Yeah, she was falling asleep.
The one that was sitting there was falling asleep. She was just quiet, didn't say anything the
Yeah,
entire
but I
class.
saw her close her eyes too, and then she
Oh really?
Guess we were too boring.
Well, I guess they didn't come back, so I don't know if they paid attention online or not, but
If they're watching, they can reach us up.
really?
We miss you. Come back Wednesday for food.
Mm-hmm.
Would love to know your name in case I run into you somewhere in the workforce.
And a photo.
Yeah, be like, we
What the rest
graduated.
of your
We
class?
graduated CNA.
Okay, right, photo first.
Some of these questions is there accepted? I don't understand.
I did the work placement exam. It told me a rehabilitation center.
I can see that.
I was like, okay. One of the jobs that I did find that I wanted to apply to was a rehabilitation center too.
Oh.
And it was in the same city that the school was in. I was like, well, that would work out really well.
What? It says, it keeps saying that. We're having trouble with your responses. Please review your questions. There's no, nothing wrong with answers. Oh, that's what. Can't really answer that question. How long have I worked there? Just
0 days.
Put that on the job application. 0 days. I have lots of experience. They're calling for clarification on skill, because it will help out. Like getting on the 0 days.
Means I'm in training. So I'll have to take my test.
I had one job who said, messages after your license. They sent me a text. We're interested in hiring you. Reach back out to us after you've taken the CNA.
I don't know why when I search CNA on Indeed, it gives me jobs that include LPN. Like, what? Those
On
are two
Indeed?
completely different things.
Something in your resume. Did you do an Indeed resume? I know for a while I was doing mismatch because on my resume I put things I was interested in, furthering myself in LPN. So it's an algorithm. Whatever you put on your Indeed resume, it specifically brings up job listings from the things you put on your resume. That's I keep getting the same thing, listings for
It's
CNA
so
or for
annoying though.
LPNs or
Like I'm
RNs.
searching CNA, not LPN.
Yeah, I think so too.
Oh.
Oh, that's weird.
There we go.
Hello? Oh, sorry. Oh, yeah, yeah.
Okay, moving on.
The
going to get into catheter care. Do you guys remember peri-care? Catheter care is peri-care with an extra or with a different step. Not really an extra step, just a different step. Serenity asks, when do I hand the patient the toilet paper to wipe, and do I wait for the soiled toilet paper to be placed in the bedpan, then dump everything? Yeah, it's a good question, Serenity. For the test, get my mic on. For the test, they're not going to be using the toilet paper. So there won't be, you just hand it to them before you leave. Doesn't matter when. Nobody cares. Just hand them the toilet paper when they leave, but they're not actually going to use it. There's not going to be any toilet paper in the bedpan. They're not actually going to use it. But in a clinical setting, usually they may throw the toilet paper in the bedpan, but it's kind of hard to reach. So they may actually have it in their hand. In that case, just grab a trash can and hold it up and let them put it in the trash can. Okay. But every situation is going to be a little bit different. You can grab a hand wipe and collect it with the hand wipe and throw it away. You've got a couple of different options. All right, so let's get into catheter care. It's on page 149 or 159. You can see all the principles that are involved. This is a long skill, very similar to peri-care. We're going to follow the care plan. We're going to do our opening. We'll wear gloves. We need a barrier, privacy blanket, linen rules apply. Patient needs to be in the middle of the bed. It's a washing skill. We're going to clean the basin and we'll do our closing. This is a mannequin skill, so you'll be doing this on the mannequin. And it's very similar to peri-care. So if you remember with peri-care, I just need to keep standing up because there's a lot I got to go over with you here. So if you remember with peri-care, we change the chucks under the patient. We use the leaves method and clean down the peri area, middle, side, skin fold. We wash, we rinse, we dried, we turn the patient over, and then we wash the buttocks, and then we change the chucks again. This is how we did peri-care. Catheter care is going to be very, very similar. Let me bring this over here where I can reach it. So catheter care is going to be very, very similar, but with a little difference. So the first thing that is different is the patient won't be lying on a pad. With peri-care, they were lying on a pad because they're incontinent and the pad's supposed to collect the urine. Well, with a catheter, the catheter collects the urine. So we don't need the pad there. We don't want to use a pad if we don't need it because pads are plastic lined. They're going to hold in heat. That's going to make the patient sweat, which leads to warm, dark, moist. So if we don't need a pad, we're not going to use one. So there won't be one under the patient to begin this skill. We're going to put one there while we clean to keep the sheets dry while we're cleaning. But at the end of the skill, we're going to take it away. So that's different. Cleaning the peri area, exactly the same. No changes. What's going to change is that we don't wash the backside. Don't need to because it hasn't been laying in urine. Instead of washing the backside, we're going to wash the catheter tubing instead. Okay, so that's our change. They don't start with a pad. They don't end with a pad. And we wash the catheter tubing instead of the butt. That's how this skill is a little bit different. So to go through the specifics, let's talk about catheters. So we're going to clean the catheter and the skin around it, usually once a shift, but we're going to go by our care plan. While we're doing that, we also need to inspect the bag and the tubing to make sure it's not near the floor and it's not kinked. The name of the game here with catheters is all about infection control. So that's the really big part of working with catheters is thinking about infection control. So everything that I'm going to be telling you about right now has to deal with infection control because catheters are actually pretty dangerous. They kill about 2,500 people a year. So we don't use them if we don't absolutely have to use them. We don't use catheters for convenience. Used to be years ago in the 70s, when you went into the hospital, you got a catheter and an IV. It didn't matter what you were there for, you got both. Catheter and an IV, because we didn't want to take you to the bathroom. It's just, that takes too much time. We'd rather keep you in bed, right? So catheter and an IV. Well, they started to realize that that's not appropriate for all situations. And in fact, catheter is actually very dangerous for patients. So we had to kind of rearrange our thinking a little bit. We don't use catheters for convenience. If the urine can come out on its own, we're going to let it come out on its own. Okay. Now, there are some situations where we do need catheters, though. So if we're going to have a surgery, well, when we have surgery, we put your entire body to sleep, including the valve that holds the bladder closed. So chances are you're going to pee all over our sterile field. We don't want that. So surgeries usually involve a catheter. That way we can control the flow of urine. If you have a baby and you get an epidural, well, then you can't walk to the bathroom. You also can't control that valve because we put it to sleep. We put everything from here down to sleep. So a lot of times with an epidural, we'll put in a catheter because you can't control the flow of urine. And when you push, everything comes out. So catheters are appropriate then. If we have an incontinent patient, urine's coming out all by itself, doesn't need our help, we don't need a catheter. Okay, so there's certain situations where it's appropriate, but most of the time it's not. We don't use it for convenience. Got it? Okay, so there's lots of different parts to a catheter and a bag, and that's what we want to talk about now. And I've got some samples to show you. And I like to go over this in detail because I have found that most people are pretty much afraid of catheters. There's a high level of fear involved in this. And if I can dispel the fear, then it's just something else that you have to deal with, right? You don't have to be afraid of it. So I want to go through all the parts of a catheter, how it works, what it does, and what it doesn't do, so that you can kind of get over your fear of catheters. So when you're looking at a catheter, there's actually two parts to the system. There's the catheter itself, and then there's some sort of a drainage bag or collection device. Okay, the catheter is what's inserted into the patient. The drainage bag holds the urine. They're two separate parts because catheters can usually be left in for up to a month. Drainage bags generally are changed once a week. So because the drainage bags have to be changed often, it needs to be two separate pieces. Okay, good. So let's start at the top of the catheter. This is the part that's inserted into the patient. Now, if you remember me saying last week that your urethra as a female is only about as long as your pinky. Okay, so that's how far the catheter would go in. Male genitalia, the urethra is longer because it has to go through all the male tissue. So it's going to be inserted a little bit further, but the action is exactly the same. Okay, it just has more tissue to go through. That's all. Doesn't hurt anymore, doesn't hurt any less. It has to be inserted further. Okay, good. Now, I'm going to explain to you how the catheter stays in just a minute, but the tip of the catheter has a hole in it like this. And that hole is what allows urine to drop down inside the catheter and be diverted out of the body. So we have the tip of the catheter, we have the catheter tubing itself, and then down here, it's going to break off into two ports. One of them is going to collect to the drainage bag. The other one will have like a little tip on it, and that is how we fill up a balloon up here that keeps the catheter in place inside the body. We're going to get to that in a minute. This port will attach to some sort of a drainage device right here. This is the drainage bag tubing. The bag, right here we have some small measurements, large measurements, and drainage port. Although the bag has measurements on it, that's not how we measure urine. This is for eyeball purposes only, rough estimates. This is not a measuring device. We're going to get to that in just a minute with the last skill. Okay. So the catheter and the bag are two separate pieces. Catheter can stay in place for up to 30 days. Drainage bag is going to be changed out more often, usually about once a week. The two together becomes the whole system. Okay. Now, CNAs can be trained to change out this bag, but that's not something that you're going to be doing right now. Again, it would require extra training. And that's because of infection. Okay, pathogens. We're going to get to that in just a minute. But remember that CNAs have to be trained to change out that bag. So infection control is our biggest risk here. And I'm going to remind you of this. This should look familiar to you. This is our chain of infection. Remember, if we have a pathogen, that pathogen has to have a place to live, but it's pretty happy there. In order to leave, it's got to find a doorway, right? And then it has to travel in fluid. Remember, they don't fly. They don't walk. They have to travel in fluid. And then that fluid has to be able to get into something else. And that person has to be susceptible for an infection to happen. You guys remember all this? All right. So this is the danger with catheters. Normal urinary system, we have two kidneys. They process blood, filter blood, produce urine 24 hours a day. Those drips, drip, drip, drip down tubes into a bladder. You guys remember all that? And then a valve down here holds that urine in the bladder until you go to the bathroom. Look familiar? Remember this? All right. When we have a catheter, we have that exact same system. Still works. Kidneys still filter blood, still produce urine. Urine drips still go down ureters into the bladder. All of that is exactly the same. What has changed is we take this catheter, the nurse inserts the catheter up through the urethra, and when it gets into the bladder, they inflate a little balloon at the end that sits at the bottom of the bladder and holds that catheter in place. To take the catheter out, they take the water out of the balloon. It deflates, and it literally slides right out. Okay. Good? Make sense? It is. Yeah. So does that make sense? So the only thing that we have messed with here is we're holding that valve open. That's it. That is it. Everything else still works. We're just artificially holding that valve open with this tube and diverting the urine through the tube rather than through the urethra. Good? Make sense? Okay, if you remember, I told you that we've got some white blood cells that hang out in our urethra, and they're looking for pathogens that stumble in. And as long as it's just one or two pathogens, they kick them out. But if we bring in a whole busload, then some of them are going to sneak past the white blood cells and get into the bladder. And if you remember, I said the bladder is the ideal breeding environment. Warm, dark, moist, all you can eat buffet, and open bar. Every bacteria in the world is trying to find a bladder to get into.
What is the size of a urethra? Like, because I see that tubing is kind of, like.
Okay, so in order to understand this, it's a very good question. But remember, we're holding that valve open, right? If we have a catheter like this, where you've got a lot of space around the catheter in the urethra, what's going to happen around that tubing? It's going to leak. That's right. So if we're holding that valve open, the tube that we're using to do that needs to be snug in the urethra. It's got to be snug. That way nothing leaks around it. If we have leakage, our catheter's probably not quite big enough. So there's different sizes of catheters. That's right. This is a 16 French. This is pretty normal, pretty standard. It's not one size fits all, but this is kind of our first stop. One size fits most. Okay, first stop. Kids are going to have smaller catheters. Larger adults may have larger catheters, but this is kind of where we start, is a 16 French. We're gonna talk about that in just a few minutes. Okay. All right. So we don't want the catheter tubing to be like this, where you've got a lot of space between the catheter and the urethra. Leakage can occur. We need it to be snug. Well, if it's snug, it's not going to be altogether comfortable. It's going to feel like there's some pressure there. Does that make sense? It doesn't really hurt. It just feels pressure, uncomfortable. Okay, good. Now your body does get used to that. Usually 10 to 12 hours, your body will accommodate. So if you tell your patient, read a book, watch a movie, take a walk, whatever you need to do, just get your mind off of it for a few hours, your body will eventually come accustomed to that. Now that's different from pain. Uncomfortable is uncomfortable. Pain is pain. Some people, very small percentage of people, but some people, when we put this catheter into the bladder, it says, hey, you don't belong. Anybody ever have a Charlie horse in your leg? How bad do they hurt? Yeah, like on a scale of 1 to 10, 22, right? Okay. So in some people, when we put this catheter in and that bladder says, hey, you don't belong here, the bladder spasms, which is a Charlie horse of the bladder. It's literally trying to push this foreign object out. Now, if you think the Charlie horses in your legs hurt, a Charlie horse in your bladder, which is all muscle, is really going to hurt. Now, when your patient hits that call light and says, ow, 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 it hurts, it hurts, it hurts, don't ignore them. Don't go to lunch. Don't take care of somebody else. Go get the nurse. If they hit the call light and go, yeah, it's just not, I'm a little uncomfortable, or I feel like I got to pee. Yeah, tell the nurse, right? Anything we know, who needs to know? The nurse. Still tell the nurse. But that's not a rush down the hallway situation. If our patient has bladder spasms, there's a medication we can give them to help with that. But medications have risks and they have side effects. There's no such thing as a medication that is perfectly safe to give that will work on everybody with no side effects and no risks. Doesn't exist. Everybody has risks. Well, this particular medication, in some people, it can put the bladder to sleep, which is good. Now it's not spasming, no pain. That's good. But it never, ever wakes back up again. So there's a risk here. We can't just use this on everybody. There's a risk. Okay. So is this something that a CNA needs to worry about? No. If the patient says they're having pain, what do? Tell the nurse. But there is something that we have something in our bag of tricks, but we can't use it on everybody. Okay?
And if you do, does that mean they'd have to be on a catheter the rest of their life?
Yes.
Because it's better to sleep?
Or incontinent.
Right.
Is that a choice that they make? Like, will the nurse tell them? Like,
Everything gets informed consent. Everything gets informed consent.
the nurse will explain to them the risk, and then at that point they choose to deal with the pain or take the risk.
Or, as the nurse, I may decide, or I may evaluate, do we even need this catheter? Right? There is option number 3. can we make do without the catheter? You know, is there another option here? Right? We don't want to go straight for the nuclear option. Can we maybe have a peace talk or something? You know, is there another option here? So as the nurse, I've got to problem solve this situation. Again, this is not CNA, this is nursing. I got to problem solve this situation and figure out the best course of action for the patient. But yes, if we decide that the medication is the best course, we have to give informed consent. Yes. Okay. Small percentage, very small percentage, but it is a risk. And how horrible would it be if you didn't know that risk, right?
So just because you give that medication doesn't mean that it would necessarily put the bladder to sleep. That is just a possibility that it might.
Right, very small percentage, yes. In most cases, it's a great medication. We give it, bladder goes to sleep, everybody's happy. But not in everybody. Okay. So good? Makes sense? Okay. So the catheter has to fit snugly, which means the patient may feel a little discomfort for a little while. But there's something else that we need to talk about that the patient is probably going to complain about. When we put this catheter in, this graphic is not correct. Okay. When we put this catheter in, the bladder will probably be about this big because right now it's full of urine. But as that urine drains down through this tube and gets collected in the bag, what do you think is going to happen to that bladder? It shrinks down. And at some point, as that urine leaves the bladder and the bladder gets smaller, this tip is going to touch the top of the bladder. So let me inflate this again and show you. So if I have this inflated and it's sitting right on top of my valve, just like that, okay, and then my catheter is coming out of the body, this is what's inside the bladder. And since the bladder is staying small, this is going to hit the top of the bladder. Now, there's only ever one thing in the world that's ever hit the top of the bladder. Anybody know what that is? When your bladder fills up, what does it fill up with? Urine. So when something hits the top of the bladder goes, hey, brain, we got to pee. Hey, brain, we're full. Hey, brain, find a bathroom. The bladder is actually kind of a stupid organ. It only has 2 words to communicate with the brain with. It's all it's got. Pee and pain. Those are the only 2 words the bladder has. It's a very small vocabulary. Okay. So this isn't pain. So if something's hitting the top of the bladder, what does it got to be? Pee. So your bladder, when a catheter is put in, is usually telling the brain, hey, gotta pee, gotta pee, gotta pee, gotta pee. And your patient will hit the call light. You know what they're going to say? I gotta pee. Now, as the CNA, most of the time you'll just say, just go, it's fine. But they don't have to go. There's no opening of this valve, which is what we do when we go, right? The valve's already open. So you can just tell them, yeah, that's the catheter hitting the top of the bladder. It's fine. That sensation will go away. Okay. It's happening automatically. You don't have to worry about it. Okay. Good. Makes sense? Good. So that's the most common complaint when we have a catheter in place is your patient will say, I feel like I gotta pee. It's happening automatically. You don't have to do anything. It's fine. Okay, good. Because if they bear down, right, this is all muscle, guys. Your bladder's a muscle. If they bear down, they're going to push urine out around this catheter. And then we're going to get some leakage. And that's going to be uncomfortable. Does that make sense? So just tell them it's automatic. It's okay. Don't have to do anything. Now, it's important that you understand how catheters come out. Right? We don't pull a catheter out that has a big balloon on it. What has to happen first? You got to deflate it, and then the catheter just slides out like a piece of wet spaghetti. Super easy. But if you don't deflate this balloon, oh, what would that feel like? Yeah, you got a balloon this big going through an opening this big. That's going to hurt a bit. And sometimes patients pull these out. Accidentally, sometimes on purpose, because it doesn't belong, especially if you've got a confused patient or combative patient. It's really easy to pull these things out. And you'll see a little blood because it's going to tear some tissue on the way, right? This big balloon has to go through an opening this big. It's going to tear a little tissue on the way. Little blood, normal. Little urine, normal. If a patient pulls a catheter out, you need to let the nurse know, because with every injury, we end up with swelling. This is not an area we want swelling, because that's going to impede the urine's ability to come out. And man, how much is it going to burn if it does? Right? But the real problem here is with swelling, I'm not going to get another one in. So I've only got about 45 minutes to work with before swelling gets bad enough to impede my ability. If you have a patient whose catheter came out and then you go to lunch and you come back and an hour later you go, oh yeah, I forgot to tell you the catheter came out in room 312. There's nothing I can do now. My window of opportunity has closed. Okay. So if a catheter comes out, you need to let the nurse know so they can make a decision on what needs to happen next. Not your job to make that decision. Just let the nurse know. Okay. If I've got a combative patient and I can get away without a catheter, we're not putting another one in. But if I need it, well, that's a different story. Okay, good. Makes sense? Okay. So there's two different types of bags that we can use. We have a big bag, like what I have there. That's the one that hangs on the side of the bed. It's big, holds a lot of urine, can last like all shift. But if your patient is out in the community, they're not going to want to carry a suitcase of urine around with them in Walmart, right? It's a bit embarrassing. People will stare. It's just not cool. So if your patient is out of bed, out of their home in the community, we're not going to use a big bag like that. We're going to use something more discreet called a leg bag. This holds less urine, but it has a benefit of being able to be strapped to the inside of the thigh or the calf, hidden under clothing. And there are people right now walking around our community with catheters, and you have no idea that they have a catheter in place because it's hidden under clothing.
It can also be strapped onto the calves.
Mm-hmm. Sure. The calf, the thigh, depending on the comfort level of the patient. Yes. Yeah. Okay. All it does is just a bag that holds urine. That's it. But patients that use these are usually able to empty them on their own. They just go to the bathroom like you do. And this little valve here, they open it up and empty the urine into the toilet, just like you do. They close the valve, and then they move on about their day. Okay. So two different types of bags, bedside bag and leg bag. Remember that the leg bag, if you help a patient put this on, the drain needs to be at the bottom. If you put this on backwards, then the tube that empties into the bladder or into the bag from the bladder will be on the bottom. It won't fill. The bag won't fill. And then what's going to happen to the bladder? Yeah, because the urine's going to stay in the bladder. So make sure, this is super, super important. When you're working with leg bags, the tube that empties from the bladder has to be at the top, and the drainage port has to be at the bottom. Okay.
Is it labeled somewhere on it, or you can see the difference?
You can see, well, yeah, you can see the tubing,
Yeah, it's going
and you
that
can
way.
see the drain.
Yeah, I see that. Okay.
Okay. All right, so here's why catheters are dangerous. Remember I said that we've got some white blood cells that hang out in the urethra, right? You guys remember that? Well, when we put a catheter in, now that's a secret tunnel. Whatever's in that catheter is not coming into contact with our white blood cells at all. It's a secret tunnel. And if we let pathogens into the system anywhere, those pathogens are going to go right up that tubing and jump out the holes at the top right into the bladder. That's right. Right into our bladder. The bladder is the ideal breeding environment. Warm, dark, moist, all you can eat buffet, which are proteins. Open bar, special enzymes that are in the urine that bacteria use to feed on. Okay, ideal environment. So we do not want our bacteria to be able to invade the bladder through a secret tunnel with no checks and balances. Because the real problem here is that it's not going to be one or two bacteria. Let's go back here and let me show you. So let's say that we allow one or two bacteria into the bag when we're emptying it. We'll get to that in a minute, but we let one or two bacteria in here. Well, remember those bacteria don't need little boy bacteria, little girl bacteria to make baby bacteria? All they need is the right environment. They zip themselves in half, and now we have two. Those two become 4. 4 become 8, 16, 32, 64, 128, 512, 1064, and so on. It just keeps exponentially exploding, okay? So by the time all of those bacteria in this bag, it starts to get overrun, so they move to the suburbs. They start climbing the tube. And the tubes get filled. So they keep climbing and they keep climbing and they keep climbing. And eventually they get into the catheter. Now we got fresh food. Oh, that's good. And they really start to ramp up production. They're also blocked from light. And the urine is much warmer. So this is like cool. Absolutely. So by the time those bacteria actually make it to the bladder, there's 1 or 2 trillion. This is a patient who goes from I'm fine, everything is great, to I really don't feel good in like a half hour. Because this is an overwhelming infection that your immune system cannot get under control. This is why catheters kill about 2,500 people a year. Because remember, we don't put catheters in healthy people. We put catheters in people that already have something else happening. So is their immune system going to be able to fight off this overwhelming invasion? No, it really puts them at risk. So we don't use catheters if we don't absolutely need them. And if we do need them, then we need to pay really, really close attention to how we're working with that catheter to prevent bacteria from being able to enter. Now, there's 3 places that bacteria can enter. This is the one that we are most concerned about as a CNA. This is the emptying port, because one of our tasks is to empty this bag. So this emptying port is how we're going to do that. If we let bacteria onto or into this emptying port, that bacteria will multiply. So what do you think a step might be when we're emptying what do you think this should not touch? The floor? Uniform? Ungloved hands? Patient? Bed? Gloved hands? Container? Anything. The tip of this port cannot touch anything. Let me say that one more time. The tip of this port cannot touch anything, because anything it touches will introduce pathogens.
She had a glove on, a clean glove, and she took a hand sanitation wipe and put it over the valve and did this. And then threw it away.
So we used to do that. We used to use alcohol pads or chlorhexidine wipes or whatever. We don't do that anymore because what we found with studies, okay, experiments, is that the plastic, oops, so this is our bag here, right? This plastic right here, when you use a drying agent like an alcohol pad or a chlorhexidine wipe, it actually causes micro cracks to form in the plastic because it dries it out, and that it will harbor bacteria.
So instead of break down the plastic by constantly cleaning it with those wipes.
Right, we just don't touch it. Okay.
Do I call the company and update the care plan or tell somebody that she did it wrong then?
Look at your facility policy first. Okay. Always go by the policy and procedure. Always go by the policy and procedure for your facility. So this port, this section of the port can't touch anything, including our hands. So to open this, this is a T valve. Okay. I don't want to put my finger here to open this, right? I don't want to touch it. We want to use our hands. Everything needs to be below the level of the T. Open, close. Don't touch that. Good? Make sense?
And we would be empty it into the stool.
We're going to get there. Just don't get too far ahead, okay? So I'm going to pass this around so you can practice opening and closing without touching that. Once it's closed and we're done, it has to go back into its little house without touching anything. So we don't want to do this. Right? That's not how we do that. So you've got to practice manually opening and closing the valve and putting it away. Now, the second place that bacteria can enter is here when the bag is changed out. When we take this bag out of the port and put a new one in, if we contaminate that port, it's going to allow bacteria right into our catheter. That's why you have to be trained to change the bag. The third place that bacteria can enter is here, where the catheter inserts into the body. And that's going to be the responsibility of the nurse, the one putting the catheter in, because if they don't maintain sterile technique, they will introduce bacteria during the insertion process. Okay, good? Make sense? Not too bad, right? So what's the most important part of assisting with catheters? Yeah, infection control. We want to make sure that we are allowing bacteria into the system anywhere. Now, when we're working with the bags, especially the bedside bags, you want to make sure it's above the level of the floor. We don't want this dragging on the floor. If this drags on the floor, bacteria. You want it above the level of the floor. You also want this tubing to be not hanging near the floor. You want it coiled on the bed or on the side of the bed, not hanging near the floor. And we never lift the bag above the patient's hips because that allows urine to run right back into the patient. I don't know about you, but urine really should be a one-way trip. Okay. Should never run back in. I don't want recycled urine in my body. Pretty gross. So we never lift the bag. I told you a long time ago that I used to watch like My 600-Pound Life and, Discovery Health shows and stuff, right? And it never failed. You would see them walking patients down a hallway holding a bag of urine like this, or putting the bag of urine on the IV pole as they're walking, and it's always above the level of the patient's hips. That urine is running right back up into the patient. Don't do that.
So if you're walking a patient with a catheter, then you need to keep it down here.
Down. Mm-hmm. Down low. Yep. Sometimes patients pull catheters out. If a patient pulls the catheter out, we need to let the nurse know. But you want to make sure that you collect the catheter in the bag and don't just get rid of it. The nurse has to inspect it. And the reason for that is, and I'm going to pass these around so you can see, if a patient pulls a catheter out and it's attached to the bag, and I look at it and this is what I see. I see a nice bubble that's still in place. That is not a problem. That is something I can handle. But if the patient, when they pulled it out, popped the balloon, now a piece of this balloon is left behind in the patient. That is a foreign object, and that can cause infections. It can cause a rejection syndrome. This is serious. Now, for me as a nurse, if you come to me and say, hey, the patient pulled the catheter out, and I say, well, where's the catheter? And you say, I don't know, I got rid of it. How do I know which one I'm dealing with? I don't. So if a patient pulls out a catheter, you're going to put it in, where is it? You're going to put it in an empty trash bag. In the bottom of all trash cans are empty bags. Just grab an empty trash bag, put the urine bag and the catheter together in that empty trash bag, put it in the patient bathroom, go find the nurse. Hey, catheter came out. It's in the shower in a bag for your inspection. Good? Make sense? Good? Okay. This, however, is the more common way that catheters get pulled out. Patients will pull them out, yes. Occasionally, a patient will pull a catheter out. But it's way more common for CNAs to pull them out. If that tubing is coiled near the floor, your feet will get tangled in it. If you're transferring a patient out of bed and into a wheelchair and you forget that they have a catheter, you will pull it out. Ambulating a patient with a gait belt. If the catheter bag stays on the chair as you're walking the patient like that, you will pull it out. It is way more common for us to pull catheters out than it is the patient to pull catheters out. And probably the most common way, unfortunately, is when we're turning patients over in bed, because you'll lean against the bed to turn them. And if that tubing is trapped between your leg and the side of the bed as you turn, you will pull that catheter out. Way more common for us to do it. Does that make sense? So if you've got a patient that you're moving in any way, turning them in bed, transferring them, walking them, if they are mobile, what should you be looking for? A catheter. Do they have a catheter? Yep. So make sure that we don't pull it out. This is, unfortunately, probably the biggest problem with ethics that we see in the healthcare setting. Because it's very common for CNAs to pull catheters out, but they don't want the lecture. So they'll leave the catheter in the bed and let the next shift find it. Yep. They don't want to take responsibility. They don't want the lecture. Who is that impacting? The patient, absolutely. It's also impacting the nurse, because whose license are you working under? The nurse, that's right. Do you think they're going to be your best friend after that? Because you just set them up in a very big way. So if a catheter gets dislodged, it happens. Will you get a lecture? Probably, because you probably could have been a little more careful. Got it? Okay. Don't put your well-being over the patient's. So report it to the nurse right away. So there's a couple of different types of catheters when we're talking about catheters that you need to be aware of. The first one is the one we've been talking about up to this point. This is called an indwelling catheter. It's the kind of catheter that has a bubble on it that we inflate with sterile water. And it's designed to stay in the body. So we put the catheter in, we inflate the bubble that keeps it in place for up to 30 days. This is called an indwelling, or, because medicine, a Foley catheter. Everything has two names. A Foley catheter. You'll hear it called Foley way more often than indwelling, okay? But if we don't need the catheter to stay in place, if we just need to empty the bladder quickly and we don't want to leave it there, we don't need this. Remember, the bubble is what keeps it in place. If we just need to empty the bladder quickly, we're going to use this. This is called a straight cath. This has three names. It's also called an intermittent cath because it doesn't stay, right? Indwelling stays. Intermittent doesn't stay. So you put it in, empty the bladder, and it literally falls out. Okay, good. No bubble. No extra port because we don't have to inflate the bubble. This has a third name. It's also called a Red Robinson. Yeah, yeah. And that's probably the most common name that you'll hear, a Red Robinson cath or a straight cath. I think the guy's name that made it is Robinson, but I can't be sure.
They're always red?
Red, yep. Yeah. Not always. I'm sure that somewhere along the line, they probably have some yellow and clear. But for the most part, you're going to see red because at a glance, it helps us differentiate when we're looking at the supply cabinet. Okay. Then there's another type of catheter. It's called a Texas catheter or a condom catheter or an external catheter. And we use that on men. Just like the name implies. Wow. Something big going on. Yeah. So just like the name implies, it is going to be used on male genitalia. It will go on similar to a condom. And it's designed to take urine that's coming out of the body and move it into a bag. It just directs the urine into a bag. But nothing is inside the patient. So we've reduced our risk of infection a little bit. Now, the problem is that external catheters are designed to be used for up to 3 days before they're taken off and clean. Well, the external catheters have a reservoir tip right here. So that's going to hold urine right up against the tip of the penis. And what do we know about adult urine? It's acidic, it's irritating. So when we take this catheter off, it's not uncommon to see a lot of redness in that area. And we want to make sure that we clean it really, really well before another one goes on. There's usually a skin protectant that we put on to try to minimize contact between the urine and the skin. Okay, good.
What do they clean it with? Like just soap and water, or do you recommend?
Go by your facility policy for that facility and that patient. It may be hexadine, chlorhexidine solution. It may be soap and water. It could be something with a zinc oxide component as a skin protectant. Every place is going to have a slightly different way of dealing with this. So go by your facility policy and the patient's care plan. But yeah, soap and water washes pretty much everything off. Yep. All right, so we've learned all about catheters. Now let's learn how to do catheter care. Well, catheter care, we're going to clean the peri area just like we did before. We're just going to hold that catheter out of the way as we do it. So once down the middle, fold our leaf. Down one side, fold our leaf. Down the other side, fold our leaf. Down the skin fold our leaf. Down the skin fold. Exactly like we did for pericare. We're just holding that catheter out of the way as we clean. Whatever we wash, we the exact same way. And then whatever we rinse, we dry top to bottom. Good? Now, once we've cleaned the catheter, remember we always go away from the urethra. We don't want to tug on the catheter itself. That's why we're going to hold it out of the way. After we do that, we're going to clean the catheter tubing itself. So we're going to hold it where it exits the body, wrap our washcloth around, and wipe away from the body with a soapy washcloth, and then we're going to fold that leaf and we're going to do it again. And we're going to fold that leaf and we're going to do it again, and we're going to fold that leaf and we're going to do it again. So 4 leaves. Make sure you're holding that catheter in place because you don't want to tug it as you're cleaning. So one hand is holding the catheter where it exits the body. The other hand takes the washcloth, wraps it around the catheter, wipes away from the body. And then we fold that over, wrap around, wipe away from the body. Fold that over, wrap around, wipe away from the body, and fold that over, wrap it around, and away from the body. Okay. Whatever we wash, we rinse. Whatever rinse, we dry. See how washing skills are pretty easy? Okay. So we want to follow the care plan here. Our care plan tells us to provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. Should we wash the butt too, just to show them that we know how? Why? Easy answer. Not in the care plan. Do you remember class 1? You guys remember class 1? Do you remember I told you that you now have all the information you need to pass the state exam? As long as you follow the care plan. You guys remember that? Are you starting to see that that's really true? Hasn't changed. Yep. All right, so to do this skill, every skill starts with the opening. Every opening starts with a knock. We're going to tell our patient what we're going to do, get permission, close curtain, wash hands, get our supplies. We need a place to put our supplies. So we'll get our barrier first and then get our supplies. We're going to get water using a paper towel to turn the water faucet on. What should the temperature be? Who checks it? Patient. And we do. What happens if it gets cold or soapy? Change it. Very good. And then we're going to put a privacy blanket over the patient and pull the sheet down. We'll get our gloves on. First thing your gloves should touch is the patient. So we've got to make sure all of our prep work is done first. We're going to turn our patient onto their side. But what do we do before we turn them? Scoot toward us because we've got to get that chucks underneath them. That's first step. Once we get a chucks underneath the patient, then we get them back onto their back in the middle of the bed. Roll that privacy blanket up just like we did for peri-care. And we're going to put a towel over their legs to minimize exposure. Wring our washcloth out because no drippy wet washcloths. And we're going to apply soap to 5 leaves. We will wash the peri area. We're going to hold that catheter up and wash the peri area down the middle, side, skin fold, and then we'll rinse all of those areas. Middle, side, skin fold, and we'll dry top to bottom. After that, we'll get another washcloth, wring it out real well, no drippy wet washcloths. We're going to apply soap to 4 leaves. We're going to hold the catheter where it exits the body, and we're going to wipe away from the urethra 4 times. Whatever we wash, we rinse the exact same way, and then we dry away from the urethra. After that, we'll cover the patient up because we don't want them exposed any longer than we have to. We're going to turn them on their side and remove that chucks. We will cover them back up in the middle of the bed and take care of our dirty supplies. You do not want to touch that sheet with those gloves. Where have those gloves been? Peri area. You want those gloves to touch that sheet? Leave your patient covered in the middle of the bed, but you need your gloves on to take care of those washcloths. Where have those washcloths been? You do not want to touch those with bare hands. Leave your patient in the middle of the bed, covered with a blanket. Take care of all of your supplies. After you've taken care of all of your supplies, then you can clean your basin and store it using paper towels. Then remove your gloves. Then remove the privacy blanket and pull the sheet up. Good? And finally, we do our closing. That's pericare. Any questions on pericare? No? Everybody good? All right. So before I show you this video, I'm actually going to talk to you about emptying the drainage bag. We're going to go through this lecture really quickly so that I can show you these videos one right after the other, and it'll make a little bit more sense. These two skills go together in a clinical setting. When you empty the bag, you're going to do pericare. They go together. For the test, they're two separate skills. So you would do your opening, catheter care, closing, your opening, drainage bag, closing. Two separate skills for the test. But in a clinical setting, they go together.
So they will still test us on the catheter where
Yes.
we're not gonna perform anything with the catheter in the real world unless we have the training.
You are going to do catheter care in the real world, cleaning it, but you are not going to change the bag in the real world.
Will we empty it?
You will empty it. That's what we're going to learn now. So you're going to clean the catheter and you're going to empty the bag. Those are CNA tasks. Changing the bag is a CNA task with additional training. Inserting catheters is a nursing
That's
job.
not something you would ever be trained on doing as a CNA?
You can be trained on it because it's very routine. It's the same process
It
every
doesn't
time.
seem that hard.
No, we put the catheter in and we inflate the balloon. So it's not a hard skill to learn, but it does require sterile technique, which is not something that you guys have learned. So you would have to be trained on how to keep things sterile. Sterile is different from clean, way different. So you'd have to be trained on sterile. Some states allow CNAs to be trained on this. Most states do not. Florida is very open with what CNAs can be trained to do. So it's all other tasks as assigned by the nurse.
So it just depends on the facility.
It depends. Now it becomes a facility liability issue, right? Right. Right. Okay. So good? All right. So let's move on to drainage bag. This is on page 164. I'm going to go through this pretty quickly. The biggest thing to remember about emptying the drainage bag is that that port can't touch anything. So page 164 tells you the principles involved. We're going to follow the care plan. We're going to do our opening. We're going to wear gloves. We're going to use a barrier. In this case, the barrier will be on the floor because that's where we're emptying the bag. We're going to clean the basin and we're going to do our closing. Step-by-step instructions are on page 165 along with the care plan. Care plan tells us to empty the resident's urinary drainage bag into a graduate container and measure and record the urinary output in mLs or cc's on the intake and output form. Now you can see a copy of the intake and output form in the middle of the second column on page 165. Where would we document on this form? Under intake or output? Please do not document under intake. When you document urine under intake, you are saying under oath that this patient drank urine. Do you guys understand that? This is a legal document. When you document under intake, you are saying that this patient drank urine. And if you know anything about lawyers, they will absolutely take advantage of that.
They take advantage of everything they can possibly
They are waiting for you to do that.
Why do you fear? I've heard constantly urine is sterile liquid.
They're actually backpedaling on that a little bit now. They're saying it's not sterile. So in this case, what they're saying is it hasn't had any contact with the outside world. Remember, outside world full of pathogens. Okay. But the term sterile actually means without pathogens. If the patient has an infection, you cannot call that urine sterile because the pathogens are in the urine. Does that make sense? So they're actually kind of backpedaling on that a little bit now, and they're not teaching that urine is sterile because we can't guarantee that that urine is truly without pathogen. Sterile actually means an absence of pathogen. What they're actually saying here is the urine hasn't been exposed to outside world pathogens.
That's not only a doorway in, but it's also a doorway out.
Correct.
So pathogens can travel out even if you're not sick.
Right.
Is there people that drinks urine? Because I have heard that of someone doing that.
I'm sure that people do. There are people that do all kinds of things that I am not in favor of. So I am sure that some people do. I'm not personally familiar with any. I don't want to be familiar with any. But I am sure that somewhere people do. There are fetishes for everything. I do know that, people trapped on an island with no, fresh water, may, because it is a liquid, may desperate times call for desperate measures. The problem is that it's going to have a lot of salt in it because urine is inherently salty and salt will actually dehydrate you. So that's not a good principle. So if you see that on a movie, remember Hollywood is not reality.
So what would you do?
There's not much you can do in reality. Not much you can do.
Don't drink salt water.
Yeah, don't drink salt water. Salt will dehydrate you.
But don't drink the pee.
No, wouldn't be.
Doesn't it have nutrients in it?
Well, yeah, anything that your body isn't using, it's going to excrete through urine. But the problem is that there's a lot of things in urine that aren't good for you. So it's not an ideal. Remember, Hollywood is not reality.
Oh, no, I know that.
Yeah. I call it Holly Weird. My husband actually came up with that. Holly Weird. All right. So we've talked about this. 2 different types of bags. There's the bedside bag and there's the leg bag. Does this look familiar? Both of them attached to catheters through the same port. It's exactly the same method. It's just one bag is bigger than the other. They both attach to the catheter the same way.
A person that usually use the leg bag at night, they would switch to the bedside bag.
Most of the time, but these are people that have been trained to change out their own bags.
I was just thinking about
The infection risk. Yeah. So as a nurse, I can train patients to take care of themselves. So just because a patient has a catheter doesn't mean they need a live-in nurse. So they can manage their own catheter with a little bit of training. Now, part of my training is going to be explaining to them the infection risk and how to change from a leg bag to a bedside bag, minimizing exposure, minimizing pathogen intrusion. But that would be part of my patient teaching. I can also train family members to help. I can train CNAs, okay, but you would need additional training. All right. So when emptying the bag, a bedside bag, and that's what we're going to empty for the test is a bedside drainage bag. When emptying the bedside bag, we're going to put our barrier on the floor. We'll put our cup that we're going to empty the bag into on the barrier. So barrier on the floor, cup on the barrier. When we go to actually empty, when we are working with that port, the end of the port can't touch anything. So don't let it touch the inside of the cup. You've got to maintain control over that port. Now you can kind of tilt the bag up a little bit to keep that port straight so it's not touching anything and to get the urine to come out. You'll see that in the video I'm about to show you. But remember that the cup goes on the barrier on the floor. What I have seen people do in the test, and I'm going to ask you to tell me what's wrong with this, okay? What I've seen people do in the test is put the barrier on the table, put the cup on the barrier, just like every other skill, and then take the bag and lift it up and empty it into the cup. Okay, so we've lifted it above their head and the urine's going to run back into the body. Okay, do you see why we can't do it that way? Has to do with gravity. That's right. All right, so to open a T-valve, we're going to slide the button to the side. Did everybody have an opportunity to practice? Slide the button to the side. After emptying, we have to close it. What happens, do you think, if we leave that port open? So yeah, everything is going to come out and it's going to allow bacteria in. So closing the port is an important step. It would be easy to forget, but it's an important step on testing. So Michael says, at work, someone was dressing a patient and put the catheter out on top of the pants. Is that something you can do, or should the tubing always go down the leg? So great question, Michael. And no, the catheter should never come up and out because, again, the urine has to drain by gravity. Okay. There's no pump in here to pump it. So urine is draining by gravity. So if we have, let's say that I have a catheter, and not trying to be vulgar or anything, but if I have a catheter in and we bring the tubing up and out of the waistband, that urine has to somehow travel up. And that's not going to be very effective. The urine isn't going to be able to go up before it comes out. This is why when catheters are inserted and you're putting pants on, they should run down the leg of the pant. Because remember, catheter drainage is always gravity dependent. So great question. Okay, so don't touch the tip of the port with your gloves and return the port to its storage pouch without it touching anything. Now, when we're measuring urine, we're going to put it into this type of container. This is a triangular graduate container. This triangular graduate container, and it has markings on it. So you'll see if you're looking at this, one side is ounces and the other side is cc's. Which do we use in medicine? So should we ever pay attention to this side? Nope. We're only going to use the cc side and we're going to round it to the nearest line. Doesn't matter whether it's up or down, we're going to round it to the nearest line. Okay. So I'll pass this around so you can take a look. And when we are measuring urine, we have to measure it in a very specific way. It's got to be on a barrier. You can't have a cup of urine just out and, on anything. It's got to be on a flat surface so we get an accurate measurement. And we have to come down to eye level. So I can't just see how she's holding it right there? You can't do that to measure it, right? It's got to be on a barrier, on a flat surface, and at eye level. And that means I've actually got to get down to eye level to look at it. All three of those things are on one checkpoint line. So if you have it on a barrier and on a flat surface, but you try to read it from up here, you're not going to get credit for any of it.
Because you're not getting an accurate reading, and it's going to be different.
So all three of these have to be met to get credit.
And this is something we do on the floor again?
So we're going to empty it on the floor,
Okay.
okay? But when we bundle it up and take it to the bathroom, we're going to set it on the lid of the toilet.
Okay.
So it's on a barrier, on a flat surface at eye level. So we're not going to read it on the floor.
Right.
We're going to take it to the bathroom. Now, can we carry an open container of urine to the bathroom? No. So we've got a chucks there. We're going to wrap the chucks around our container to transport it to the bathroom. Okay. We have to document on the output section, and we're going to wash our hands after we document. Always follow the care plan. So here's our steps. We're going to knock, introduce ourselves, tell the patient what our skill is, get permission, close the curtain, wash our hands. We'll get our barrier, put it on the floor. We'll get our cup and put it on the barrier. We're going to put some gloves on. We'll empty the bag. And guys, it's not Maxwell House. It's not good to the last drop. You don't have to get every single drop out of this bag. Just empty it until it's, empty. But it doesn't have to be 100% bone dry. Okay. Don't let that port touch anything. We're going to close the valve and tuck it back up into its house. And then once it's back up into its house, then we'll wrap the chucks around it to take it to the bathroom, put it on the lid of the toilet, on a barrier, on a flat surface, and we have to get down at eye level to read it. Now, I'm going to tell you something for the test. This bag will have liquid in it. You are really going to empty liquid into the container. It's going to look like urine, but it's not. It's just food coloring and water. It's yellow tinted. Now they tint it so that it makes it easier for you to read it. If it was just plain water, it would be really hard to read. Okay, so it will be tinted yellow so that you can read it easily. It's not really urine, it's just water.
So do they have a bathroom there that you can post your lid down to, or we would be using a commode?
So your testing center, it depends on how the testing center is set up. It will either be a regular bathroom with a toilet with a lid or a tank, one or the other, or in most cases, it's a bedside commode, like what you see here.
If it's one with an actual bathroom, when you, like if you say you got that skill, when you're ready to go look at the...
They're going to follow you.
Okay, so you don't have to I guess you should still announce, okay, I'm going to go look at the level of this now.
Yeah, I'm just going to take this in the bathroom to measure it and empty it. I'll be right back. Yeah, that's fine.
But they're going to follow you.
When you enter the patient's room, will you? No, never mind. It depends on the facility.
Yeah.
Yeah.
Not the house.
No.
So if we commode, so then we empty it in the commode. Is that what we do?
Right. We're going to empty it in the commode in most cases. If it's a toilet, empty it in the toilet.
Right.
But we're going to empty it, and then we're going to rinse it, dry it, store it with paper towels like we do everything else. Remove our gloves, do our closing, document, and then wash our hands again. What's that? It does go by quarters, yes. Yep. And we want to round to the nearest line. So good? Any questions? I'm going to show you these two videos together. And then we have one more skill that we have to do because we have to go back and do range of motion of the elbow and wrist. We did not get to that. So, but you guys already know how to do that. I'm just going to show you the video for it. Okay.
So when we're measuring on this, we would go like that would be 75, right?
Right. So this is the line for 300. This
Uh-huh.
is the line for 350. What would that little line in between be?
325.
Right. And we're going to round to the nearest line.
So round to this nearest line right there. Or do they want that one?
That one. If it's nearer to that one, we're going to use that
Okay,
one.
gotcha.
Okay. Whatever the nearest line is. Okay. So let's watch these two videos. And then I'm going to talk to you about range of motion, elbow, and wrist, and we'll watch that one, and then we'll be done for today. I take my test tomorrow. I won't let you down. Good luck to you. Okay, so first we're going to watch catheter. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do catheter care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, and now I'll gather my basin and soap. And a set of gloves. Let me try that again. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloths in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Ms. Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Ms. Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. I'm going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Ms. Jones, can you scoot to the middle of the bed, please? Thank you. Ms. Jones, can you scoot toward me? Thank you. And roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Ms. Jones. And scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out and apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we washed. I'm going to hold it where it exits the body, wrap the washcloth around, and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well, and we're going to soap 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf, always going top to bottom. And then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom, fold that leaf over, clean down the other side of the labia, top to bottom, fold that leaf over. I'm going to clean the skin fold between the groin and the leg, fold that leaf over, and clean the other skin fold between the groin and the leg, and then set that washcloth aside. I'm going to take the final washcloth and wring it out really well, and we're going to rinse all of those areas the same way that we washed them. So I'll hold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over, clean down one side of the labia, fold that leaf over, rinse down the other side of the labia, fold that leaf over. We're going to rinse the skin fold, fold that leaf over, and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. Ms. Jones, I'm going to cover you back up. I'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not kinked. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be clean the way we clean everything else. We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll open the drawer with the paper towel and return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Ms. Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Ms. Jones. And scoot back to the middle. making sure the patient is not laying on that catheter tubing. Okay, Ms. Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the bed. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Ms. Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away, and then I'll remove my gloves. We'll throw those away. Okay, Ms. Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. You put this in dirty linen. Okay, Ms. Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just going to open your curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections that need to be made, and then tell the evaluator my skill is done. Hello, Ms. Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not kinked, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters, or cc's. Once we've measured it on a barrier on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down. Use a paper towel to pick it up. Paper towel to dry the outside. A paper towel to dry the inside. And we'll discard this, and then one for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call light there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done. All right, any questions on those two skills?
Are most places gonna use military time?
Yes, because healthcare occurs 24 hours a day. Most places will use military time. You can use regular time on the test, that's okay, but you have to indicate AM or PM if you're using regular time.
Okay.
Make sure. I do have a lesson in your skills book on military time. So you can look in the table of contents for that. Let's see
I
here.
don't feel like I've been going over the cards, I've been going
Page
over
49.
the supplies for each skill.
Yep.
How, like, I'm trying to memorize them according to skill. I'm using the cards and then working on it at home. I
Right.
still don't feel like in the stress of the moment, I'm gonna like get a washcloth, like on the test. Is that a failure? Is that called
No.
for?
There's no checkpoint that says that you got the right amount of supplies. There's no checkpoint for that. What you're graded on is what you do with those supplies or don't do. If you don't take enough washcloths and now you can't rinse something, if we leave soap on the skin, what does that do? Dries it out. So you're not graded on the supplies that you get, you're graded on what you do or don't do.
I don't know if you were here this morning when we talked about that, but you are allowed to stop what you're like, as long as your patient is in the center of the bed, you're allowed to stop if you're doing wash your hands, go get the supply, and then return what you were. And that's considered a correction.
Yep. Very good. All right. So page in your skills book, page 49 talks about military time. I have an activity there. But let me make military time easy for you. How many hours are in a day? Who was the wise guy that said, oh, let's count to 12 and start over? Makes no sense, right? If there's 24 hours in a day, shouldn't we use all 24? Instead of getting to 12 and starting all over again. I mean, it just doesn't really make much sense. So it's all military time is there's 24 hours, we're going to use them all. So instead of going back to 1 after 12, we're just going to keep going. 13, 14, 15, 16, and so on until you get all the way to the end, and then it starts over again at 0. So midnight is 0, 0, 0, 0. Make sense? Once you start to get that, military time becomes very easy. Just keep going. Don't start over. Dorcas says, is the skills accepted in all state and at Prometric centers? Because I took the first exams in the school. Now am planning to take it in a Prometric center. Okay, what I think you're asking, Dorcas, I'm not entirely sure, but all Prometric testing is uniform. So if you're taking the tests at a Prometric testing center, then the skills are going to be according to what we're teaching you, because we're teaching you Prometric skills. Okay, so the scenarios are the same, the principles are the same, If you're testing in New York or Texas or any state that uses Prometric, what we're showing you is exactly how the testing is going to work. Now, the other part of your question, though, is are Prometric skills accepted in all states? And I want to answer this two ways. States that don't use Prometric for testing, the scenarios might be a little bit different. The principles I'm teaching you is always the same. Doesn't matter what state you're in, patients need their dignity protected. They need privacy. Whatever you wash, you're always going to rinse. It doesn't matter whether you're in Idaho or Iowa, right? If you wash something, it's got to be rinsed. It doesn't matter whether you're in Hawaii or Havana. If you're going to touch body fluids, what do you need? Gloves. So the principles are the same. They never change state to state. But as far as the testing goes, some of the scenarios may change. That's what would be different. And as far as are these skills accepted in all states, well, I'm going to talk a little bit more about that on Wednesday during graduation, so stay tuned for that. Anna says, is there any order when to raise and lower the bed for catheter care? That's a good question. So you're never going to get an order to raise or lower the bed. That's going to be up to you. If you want to raise the bed up to make it comfortable, raise the bed. If you do raise the bed, what do you have to do at the end? Lower it. But it's not going to be on your care plan. There's not going to be any order for it. That's completely up to you whether you want to or not. Just don't forget to lower it. Okay? Good questions. All right, don't look at this yet. Page 49 is going to talk to you about military time. So if you're not familiar with military time, you might want to do that. But I want to go back and talk to you about range of motion, elbow, and wrist. And this is going to be on page 78 and 79 of your book. This is the one skill we have not gotten to yet. But we know everything that we need to know to perform it. We're going to read the care plan. We're going to follow that care plan. We're going to put an opening in front and a closing in the back. Super simple. So can somebody please read the care plan to me? On page 79, top of page 79. Can somebody read the care plan to me? Okay.
Provide the following range of motion exercises for the resident's right elbow and right wrist. Flexion, extension. Provide 3 repetitions of each exercise. The resident is not able to help with this exercise.
Okay, so this is super easy. We're exercising the elbow and the wrist. It's telling us to do flexion, extension. And if you remember, flexion, extension is up, down. So we're going to go up, down on the elbow, and we're going to go up, down on the wrist. Care plan says 3 times each. Put an opening in front, put a closing in back, monitor for pain. That's the skill. That's the whole skill. So I'm going to show you this video in just a minute to show you how this is done. But it's just up and down. We always have to make sure that the elbow is supported. You know how to do this. There's nothing earth-shattering here. You already know how to do this. I will show you this video just so that you have all of that. But I do want to talk to you about supplies really quickly. We talked about it at the beginning. You just brought it up again. Range of motion has no supplies. That's really easy. Pulse and respiration, the supplies are a pen and a documentation form and some way of measuring time. That's pretty easy. What do you use to brush your teeth? Okay, source of water. So toothbrush, toothpaste, source of water. Okay, you need a towel to wipe your mouth off with afterwards, right? You don't just walk around with like foamy stuff there. And you need a place to spit, don't you? Okay, so the same things that you need are what the patient's going to need, except we're going to have to bring everything to them. So instead of standing at the sink, we've got to bring a cup of water to them. Instead of them spitting into the sink, we're going to bring a basin to them. Right? We're still going to use a towel, but we'll put it on their chest just in case anything drops down. So when you're trying to learn supplies, make them make sense to you. Don't just memorize a random list of stuff. Start trying to think, okay, it's mouth care. What do I need to brush my teeth? I need the same thing to brush somebody else's. Now, the one supply that doesn't follow that rule is gloves, because you don't ever use gloves on yourself. So that's something new and foreign. So we have to think about, if I'm going to touch body fluids, personal skin, or non-intact skin, I need some gloves. Does that make sense? So make supplies make sense to you, but I've got a tip for you when it comes to washcloths. If you're washing a small body part, like one hand or 1 foot, hand care, foot care, you need 2 washcloths, one to wash, one to rinse. All other washing skills require 4. So hand and nail care 2, all other washing skills 4. So hand care, small body part, foot care, small body part. So 1 washcloth to wash, 1 to rinse. Everything else you need 4. So partial bed bath, peri care, catheter care all require 4. Okay, that's just a little helpful tip. You're welcome. The only skill you need 2 towels for is partial bed bath. 1 to cover the bed, 1 for the patient. All right, so let me show you this range of motion, elbow and wrist. It's like a 1-minute skill. And you have 1 chapter of homework tonight, and that's chapter 10. It's going to be on employability, stress management, how to keep yourself healthy, that type of thing. Make sure that you kind of cover it. But we are going to go over a lot of this concepts in class on Wednesday as well.
Did you need the grade for chapter 9?
I'll get it from you next class.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing great. How about you?
Great. I need to do some exercises on your right elbow and wrist. Is that okay?
Yes.
I'm going to close the curtain, wash my hands, and I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to do all the exercises. All you have to do is let me know if there's any pain or discomfort as we do this, okay?
Okay.
The first exercise I'm going to do will be on your elbow. We're going to bend your arm up and back down to the bed like you're making a muscle.
Okay.
We'll do this 3 times each, okay?
Okay.
So the first thing I'll do is bring your arm straight down. We're going to go all the way up and then all the way back down. Feel any pain?
No.
All the way up and all the way back down. Still okay?
Yes.
And 1 more. Very good. Okay, now we're going to work on the wrist. We're going to bend it forward and backward like you're revving a motorcycle.
Okay.
We'll do this 3 times. So forward and all the way back. 1. Feel okay? 2. 1 more. Forward and all the way back. Is there any pain or discomfort?
No.
Thank you. Is there anything else I can get for you while I'm here? A
No.
magazine perhaps?
No, thank you.
Are you comfortable?
Yes, ma'am.
Call light's right there. If you should need anything at all, please let me know.
Yes, ma'am.
I'm going to open the curtain and go wash my hands. After washing my hands, I'll review all the steps of my skill, make any corrections, and then tell the evaluator my skill is done. All right, so you're going to read chapter 10 and do the test in the back of the white book. Number today is CPR from 2 to 6, $45. After today, it goes up. And you're going to return your yellow book on Wednesday. Please make sure that you bring your yellow book back to class. I got yours. On Wednesday. And I'll collect those. You'll want to make sure you're in uniform. We will take a class picture on Wednesday as well. And here's your review sheet for today. And those of you joining us online, you can access that in our online course in lesson 1. What is the main skills in the exam? Would we perform 20 skills? No, you're not going to perform 20 skills. Prometric is going to select 3 skills that they're pre-selected care plan sets. There's 11 sets, and you would be assigned one of those to perform. I take my test tomorrow. I won't let you down. We wish you the best of luck. Let us know how you do. Good vibes out to you. All right, guys. Until next time, we're going to go ahead and sign off. Happy caregiving. And Caitlin, you can end stream.